coming up on this episode.
It's on Spotify and YouTube. I actually got my first episode taken down. I'm so upset from YouTube for medical misinformation. So I've got to kind of go through that episode and take out. It was a wonderful conversation with a woman. She goes by Speaker Lynette on TikTok and other socials, but she had stage 4 metastatic cancer, I think started in her breasts. And she actually at one point stopped her chemo and she did natural modalities, but it worked for her. And she went from 12 centimeter tumor to nothing.
And that doesn't, the frustrating thing is the misunderstanding of what medical misinformation is, because that's her story, right?
Correct.
And the body doesn't read the textbook always. I always say, like, that's a big deprogramming thing that we have to do, though.
Oh my gosh, yes.
Like, I've had to do a lot of that, and that's actually something really interesting to talk about, so I'll save that.
All right, so welcome to What the Healthcare Podcast, a platform designed to educate you, the listener, by bringing on healthcare professionals and patients who have been injured by the system to share their stories and experiences. Today, Thursday, October 24th, 2024, I am joined by the gorgeous Dr. Leila. Dr. Leila is a former corporate medicine doctor who is currently building her own practice. Welcome, Dr. Leila.
Well, thank you for having me, Emily. It's so nice to see you in this way.
You as well. So let's start with, I think this is going to be a really good conversation for people to hear and listen to.
Yes.
So let's start with this. Give us a rundown of who you are, what got you into medicine, and maybe what got you out of medicine as well.
Oh yeah, that's a great question. So I'm just your typical girl from the Midwest. I'm from Ohio, and of course, all of a sudden I'm having a frog in my throat, but
it's okay.
That'll go away. But yeah, so I was born and raised in Ohio. I went to Ohio State undergrad. You know, when you're raised with a foreign parent, they kind of make you think that you have to be a doctor or a lawyer or an engineer or something like that. And I didn't really know what I thought I wanted to be a doctor because I liked science. And that's the funniest part about becoming a doctor, is that it's like not any of what you thought it was going to be.
You wanted to be a nurse or be a doctor. Is this like the vision that you had?
Oh, no. I'm sorry. No, thank you.
What in the actual F? We're not even doctors anymore. What is a primary doctor if you can't even order a screening? So I'm not good enough to order the MRI for the person with the headache, but I'm also not good enough to do a screening CT. What? Is this just like a cash grab? Is this a cash grab? Make it make sense.
I had a really great time in undergrad, but I worked 3 jobs in undergrad, so I ended up not being the type of person that was studying really hard for my MCAT, and I didn't do very well. Can we swear on this podcast?
Oh, you can. You sure can.
Okay. Well, I shit the bed with the MCAT. So I did. And it's okay because it's a standardized test, and that's it's a whole other world of knowledge. It's a different kind of person that does well on those. You can be trained to do well on that. But yeah, so then I ended up working in actually industrial engineering prior to going to this. I didn't study industrial engineering, but then I kind of got out of that because I was like, man, it just feels like this is all about money, and I don't feel like I'm helping anybody. And then here we are 20 years later, 15 years later, and I am a physician that I'm like, wow, I feel like this is all about money, and I feel like I'm not helping anybody. But I ended up going to the Caribbean for medical school, which I went to St. George's University, which is the Harvard of the Caribbean, they say. And that's a little joke we have. Oh. And then it's like, but and then I did all my clinical rotations in New York City, which is a really great learning experience, and then decided that I was just a Midwestern girl, and I came back to Ohio, did my residency here, started my dream job at the dream company that was sold to me as something that it's physician owned. You're going to be a part owner of this. But really what that meant was that you as a physician carry the overhead, and you're sold this dream of getting everything over your expenses. But once you actually learn the intimate details of what that means, you start to realize where all your expenses are that have nothing to do with actual health care. And so here I was trying to do the best I could as a family physician. And I found myself struggling to keep up with the amount of patients I had, and I wanted to see them for longer than 10, 15 minutes a person. So I ended up doing that. I ended up spending 30 to 40 minutes a patient, and guess what? That put me into $250,000 worth of debt to my practice. And so I stopped taking a salary so that I could work my way out of debt. And I found that even at some point, I could take no salary and I could be billing, and I was still actually going into debt. And you start to realize where all the money's going. There's more to that. But yeah, so I started crying on the internet, and here we are.
The way physicians are expected to take responsibility for the failings of the entire healthcare system is so unhinged. My corporate medicine job, I had about 2,000 patients, and I was miserable all the time, literally coming to this platform to sob every single day, not taking a salary for 2 years so that I didn't have debt to my practice. And let's not forget that I owe $500,000 to the US government for my student loan. I'm not sure who you are, why you're taking such an aggressive stance with somebody who's trying to exit the system for themselves and their patients, but this attitude is you essentially blaming me for the shortage of PCPs because I'm choosing to exit the system and not accept insurance because it was killing me. Girl, please. The reason there's no access to healthcare is because the reimbursements for physicians, especially family physicians, is going down, down, down. This is who's to blame. 2025, they're going to cut physician reimbursement by 2.8% in Medicare. Year after year after year, they cut reimbursement. Physicians are affected by inflation just like everybody else, not just in their home lives, but in their ways that they run a business. How can we fucking keep up with this? Why is it worth it to suffer in the system every day and have the moral injury of not being able to treat your patients the way you want to treat them, just to have some moral high ground of thinking that you're saving the world when you're not?
Well, first of all, I have so much respect for you for leaving that industry. I know you're kind of still in it and starting your own, but doing your own thing, leaving the spot you were in. I feel like it, I don't know how long it actually took you to see that. I feel like for me, it took, I was in healthcare for 25 years and I didn't really see the business side of it until I moved from nursing to administrative. And that's when I was like, oh my God, this is nothing but a business. And all these decisions that are being made by people with zero clinical background. Financially, it's coming from a financial perspective only. Patients aren't being considered. Like, what is going on? So
Yes.
What was it that really sticks out to you now that you can pinpoint, like, that was the moment that you realized this is a business? Was it a particular event, something leading up to the event? Like, what would you say?
Well, I knew it was a business. I just didn't realize it was a business that I could not thrive in as a physician. I realized I knew that it was a business from day one because you just kind of see it happening. But then what you realize, I'm trying to think of the exact moment and I honestly think it was after being on TikTok for about 6 months that people started reaching out to me. Are you familiar with Dr. Lee, who started Take Medicine Back?
Oh, yes. Yep. I know Dr. Lee.
He reached out to me and started saying, some of the things you're discussing sound a little fishy. And we had like a really long conversation. And I literally, even though I figured out that all this money was going to these administrative overlords, I did not realize that the healthcare company that we had partnered with, Agilon, was a private equity run company. And the founder is on the board of Boeing. And if we can,
oh my God.
And Mitch Lee figured that out for me. And so if I had not come onto TikTok to talk about all of this, like basically as an outlet for me and my burnout, which I didn't really fully understand what was driving that burnout, other than I honestly initially was more burnt out thinking that patients were burning me out. But TikTok, the sexy dancing stupid app that everybody disregards, showed me patients doctors, nurses talking about stuff that I didn't even know about as a physician, okay? Like 12 years of higher education, had no idea what private equity was. And so I would say that February of 2023 maybe is about the, or no, that was, yeah, it was about February. It was 2023 that I was like, this is terrible. And then it was really the turning point in 2024, like January, February of 2024, when I realized how bad it was and I knew I had to get out. And I ended up quitting in April. I was supposed to give a 90-day notice. I negotiated down to a 60 days, but after 30 days, I literally said, what do I have to do to get out of this? Do I have to check myself into a mental institution? Like, cause I will, cause I can't do this a day more. I can't do it a day more. The moral injury, all of it, I couldn't do it. It was killing me. So
I got the most validating compliment ever today. I'm a family physician. If you don't follow me, I'm always complaining about my job. Love my patients. Hate the system. I was seeing a patient for a hospital follow-up, and at the end of the visit, she goes, I really appreciate you. Are you okay? I was like, thank you. And no. Why do you ask? She was like, you sent a message to me on the portal at 11:30 at night on a Saturday. And I was like, And it was extremely validating to be seen. And honestly, I never even really think about that, but some of the things my patients must get at like the weirdest hour. Hey, it's me, Dr. Leila. All of your stool studies came back normal, so if you're still having diarrhea, let me know. 1 a.m. on a Thursday. Hey, it's Dr. Leila. All your labs look good. And by the way, happy birthday. 3 p.m. on Christmas. That was a message to Jesus. Get the joke? You're completely missing the fucking point. The whole point is that everybody is experiencing a terrible healthcare system. Terrible. And all they do is they see us physicians spend a few minutes with them and they think that we're making a shit ton of money. But the reality is, this is the reality. The reality is in order for me to actually get a salary as a physician, I have to churn through as many patients as possible in the day to even be able to stay afloat. Okay? That's the point. The whole point is about showing you guys that healthcare is not okay. And if you think doctors are the problem and that we're just walking away rich in this scenario and that we're just like rich and happy and we have all this fucking money and we spend no time with you and you think that is what's going on, you're wrong. You're fucking wrong. You're wrong, you're wrong, you're wrong. And that's why I'm cursing at you. Because despite the fact that you follow me and engage with my stuff, I can't believe you don't even see this. I can't believe you're centering yourself in your issues of losing salary during the pandemic. I made mistakes in my decisions. That's why I'm pissed. I am paying off my loans. I'm doing it because yes, I did agree to that. You are correct. And that's why I'm following the law and paying it back. That doesn't make it right.
The other things that it's not one thing that did it, and that's the problem. It was that I was a healthcare provider in this system, and during that time I was going through so many things in my personal life that had to do with medicine. I'm actually a cancer survivor myself. I had stage 3 thyroid cancer before I went into medical school at all, and so that was part of me wanting to do that. And then once I was actually a practicing physician, attending physician, my boyfriend was in a catastrophic motorcycle accident and he was hospitalized for months in the surgical ICU, had no medical attending. Like there's so much here, Emily. Like there was no medical person on his team. It was only the surgical team. He had Medicaid at the time because they put him on it for that reason. And so basically the only people treating him were the residents on the trauma surgery team. And they were not doing a great job, in my opinion. And so I was like, I was begging for help, and I'm a physician in that system. And I knew he had like he was like in septic shock and they weren't doing blood cultures. That kind of
gosh.
Thing. Yeah. So that frustration was the first thing that started happening. But during that time, my mom also had stage 4 lung cancer. And so at the very same time, we have the pandemic in 2020, 2021, and my mom was diagnosed with cancer in 2020. And then my boyfriend was in the accident in 2021. And all of that together, navigating it was just, it was so eye-opening. And I was gaslit in the healthcare system by my own colleagues. And saying that out loud made me get in a lot of trouble at my work. In fact, I was constantly being emailed by the legal department, the chief medical officer. What will patients think? What would take this video down? Take this down, which were my personal experiences. And I wasn't talking about patients. I wasn't talking about anything, but they didn't like it. And so I would say that the big thing that went click was when I was so miserable. I saw all this happening, and I finally realized who was driving it. And that was the corporate interests, and that had nothing to do with healthcare. And that's kind of when I was like, oh, I have to get out of this. I can't stay in this. This is terrible. So long-winded, but
yeah, no, it's okay. First of all, feel free to ramble. And this is what this platform is for. And I have been so excited to get you on here because I feel like, and I'm guilty of this myself, I feel like two things. So when I walked away from the system, and I would venture to say you can probably empathize with this, I felt so many different emotions. And one of those emotions was guilt. Like I felt like I had been a part of this system. Although I thought I was helping people, was I? And was I part of that, gaslighting? Did I gaslight patients unbeknownst to me? It wasn't intentional. So I feel like we all kind of feel those emotions coming out of the system. And I would also assume that you seeing things from now this different perspective, from this patient perspective, probably really gave you, this eye-opening, perspective. Yes. And so, but what I was going to say is, I've been so excited to get you on here because I feel like doctors take the brunt of everybody's frustration with this system. And I think it's important that we educate the public, because this is never going to change until people are educated into what's really going on. And so doctors are the face, and they get the brunt of it. And they have no idea just how tied doctors' hands really are. So I want you to go into that, those things with as much detail as you possibly can, because I think it's super important.
Absolutely.
Unless you're a physician on this app that is only saying positive things and giving education, you are going to be attacked professionally. Our jobs are often threatened when we say things that go against the norm. People who don't agree with us try to dox us, try to get us to lose our jobs. And a lot of people who are very satisfied, especially financially, with the status quo in our respective organizations, don't want us to spread certain types of messages, because it is true that we're brainwashed, and it is true that we have to break out of that. But what I have found a lot more fascinating is how my opinions and the way that I'm trying to express them amongst my friends who are physicians has affected my personal life. I can think of 2 examples in recent history where dinners did not go as well as planned because Leila decided to get on her soapbox and challenge the status quo at the table. The first example was when I went out to dinner and told all my friends that I'm leaving and doing direct primary care. I'm not doing this anymore. And I started to say the various things that kind of led me to feel that way. One of those things being my admission in this group that I feel like we have been completely brainwashed to say things like, this doesn't change management, so why would you order it? Or it's not cost effective. And when I suggested that, the physician friends that I had at the table, not all of them, became defensive, because in their world, they've been practicing medicine the way that they've been taught. And they're practicing it that way because they really do feel like it is the best way, because that's what we were taught. And if you follow me at all, professionally, just the amount of drama that you get when you try to challenge the status quo. I mean, lawyers get involved. It is not for the faint of heart. So it's easy for those of us who are doing that work in real life to feel defensive when we see a comment that implies either that we're not doing it or that somehow it's super easy with no level of sacrifice to our personal and professional lives. And we need you to understand that as patients, because you need to have patience with us and with other physicians as we navigate this. Do we have a tremendous responsibility? Yes.
Is it all of our fault? No, it is the system that we have been in. And lastly, the groups of physicians who have collective lobbying power in the United States, many of them have been bought by corporate interests. There are some things that I agree with about that the American Medical Association does, but there's things that I don't agree with. So those of us who don't agree with the positions of the major medical associations, we're trying to fight back. And we have a lot of places where we are, but we're just not there yet. There's just been so much hate towards physicians that people don't really even want to listen to us anymore. And the only ones that they're listening to are the ones that are kind of bought by corporate interests because somebody can make money off of it.
Wonder too, I want to go back to even med school. What was your experience like with that?
So the first few years of medical school, I would say most medical students would probably say are the best years in medicine that you'll ever have because you're simply learning. You're just learning. You're engaging with the science. All of those weird diseases that are the zebras of the world, we learn about all of those. We get to learn all those little things. I loved the first 2 years of medical school. It's the moment you step into a hospital that you are hit in the face with all the other aspects. So the first thing is that you don't actually, if you've never been in healthcare before, which most people haven't before they go into their professional degree, I'm sure you remember this the first time you went, even from nursing clinicals to just practicing, you don't know, even just checking, knowing what an ostomy is, knowing little things like that, knowing what anything means. You don't know. I didn't know what the things were on the wall. I didn't know how do you even look at something? How do you look up something on the computer? How do you fully apply everything that you've learned? And so you're reliant in that moment to learn all these practical skills by your peers, in your residents, your attending physicians. But a lot of those things you're taught by nurses because they're the ones that have the time and more hands-on time with the patient to show you the tubes and the drains and the this and the that. And here's how we hook this up. And that's not taught by an attending physician. And the problem is, oh gosh, everybody's so competitive. And everybody's got their own stress. And as I've mentioned a lot on my channel, the culture of medical school in the clinical realm is very bullyish. I would say they're I would say the military and medicine are the last remaining industries where it's openly accepted that you will be humiliated and you don't have anybody. If you complain about an attending humiliating you, and that's a person that's going to give you your recommendations, your letter of recommendations, and write on your transcript after everything, think about the retaliatory nature of that. So you definitely don't want to speak up. As a woman in medicine, who, thank you, by the way, calling me gorgeous, that is so kind of you.
Yes, you
thank
are.
you. But there's something, I am a very girly girl, and I found myself in medicine being either put into the category of a slut or a bitch. And you either are, if there's a male attending or resident that's flirting with you and you reject them, then you're a bitch. If you do that, then somebody finds out, then you're a slut. It's just, wearing lipstick was a thing. I actually, that was actually a thing that people were like, I can't, wearing lipstick. Just, you really feel like you have to conform. And what I want people to realize is that the people who are teaching you are the people who have been incubating in this system for years and years and years. And they're the ones that pass on not only their medical knowledge, but their generational trauma of medicine. And unfortunately, most of them went through this when they were in their young formative years, when they start to learn how to engage with people. Tell me you're an old man doctor without telling me you're an old man doctor. My name's Leila and I'm a family medicine physician, and this comment is on a post where I talk about the toxic educational environment of medicine, whereby attending physicians humiliate trainees in order to give them strength, how that essentially causes harm. This person has commented on my videos before in a similar manner, and I do think that they are a physician that just essentially is old school and really appreciates the paternalistic aspects of medicine that are ultimately causing terrible relationships between doctors and patients and ultimately poor patient outcomes. The comment reads, I think it's great. Teaches you not to take insults personally because patients will do this to you. Keeping you up to date. And yes, our attendings are better than students and residences. Duh. You want to know what else helps you not take things personally? Time, experience, and therapy. Unfortunately, this person sounds like an abuse victim. And ultimately, even when we talk about other types of abuse, we see that this is why there's generational trauma and generational abuse. This is why there's something called the abuse cycle. And this is a perfect example of it because this person actually thinks that it's better to humiliate trainees. So let's talk about this next part. This person is also saying essentially that this is going to help you with your patient care. It's going to help you engage with patients in a better way. How fucking crazy is that? So at the end of the day, what this does is it teaches you to shut down and become defensive and domineering with a patient. It doesn't actually help with patient care. At the end of the day, patients are not experiencing good care and feel gaslit constantly in the healthcare system because of physicians acting this way. And do you think that in another industry, you would be allowed to humiliate people like that without going to HR? Do you realize that there's no HR in medical school? We're not unique in medicine to say that we're the only people that have to learn this lesson to deal with people, and other industries don't have that. And somehow people learn. One last thing, this tremendously contributes to burnout, and it's not helpful. So essentially, I was very much abused in the system, especially when I was doing my medical rotations in New York, just the way that people acted there. And at the end of the day, yeah, I'm able to manage things, but it didn't help me very much, because I still wanted to quit. You know what I mean? And the reason I wanted to quit is because of all the consequences of this toxic culture. And so essentially, I'm not sure that this is doing what you think it's doing. And I try to explain to people that it's almost impossible, the amount of knowledge that you're expected to retain and absorb, in addition to knowing what's happening, day to day, in addition to navigating these interpersonal relationships with all kinds of medical staff, some of them who've been very poorly treated by either medical students, residents, or physicians who then resent you as a new medical student. It's like you're sitting in a sewer. You're ready to become a teenage mutant ninja turtle, which is what I feel like I'm doing now. So
it's kind of like a cult. I feel
is.
I think you had a video at one point, if I recall, mentioning that med school, something about pimping out med students. Can you expand on that a little bit more?
Yeah, so there's a medical education technique. And when I say it's a medical education technique, it's because it's actually been described in medical literature as a educational tool called pimping, and it's from a German word, and essentially it's getting questions out of a person. Now, I posted a video regarding what pimping meant. It's essentially the process of creating a stressful and intentionally humiliating environment for a trainee, and so it's like, oh, how did you where did you get the vitals on them? Oh, you didn't? Oh, why didn't you do that? Or, it's just like going on and on and on. I give an example on my page of an attending asking questions to the point where eventually the medical student doesn't have the answer. And that's the point when then they get humiliated and they're essentially told that you didn't prepare. If you don't prepare, don't even come to rounds. So literally stuff like that. Usually those kinds of questions that are being asked in the pimping way, which is, again, intentionally humiliating. It's not about putting pressure. It's okay to be under pressure, but when the environment is intentionally stressful to create and reinforce a hierarchy, an intellectual hierarchy, that is when how can you possibly learn to be an empathetic person with a patient if that's how you're learning these things? That's how we end up having these crazy egos, because once you get to the place where you do know all these things and you've with a gun to your head learned all these things, now when a patient asks you a question or challenges your knowledge with something they read or saw, it's almost like a trauma response to be like, that I've never heard of that before. You know,
Yeah.
like it's like, and then to essentially do the same thing to a patient, humiliate the patient for the thing that they have a question about, when questions are how we learn more things. I mean, we don't know about things until we ask more questions. So a lot of physicians that I saw on that commented on that video, there were many of them defending it.
Oh my gosh.
And I was like, see, this is what I'm talking about. There's this old school generation of doctor that thinks that if you have not suffered tremendously, then how can you ever possibly, you know, handle something under pressure? You know what I mean? Like, how could, and to me, that's a silly, I don't think you have to humiliate people to get that, to be under pressure. Like, it's already pressure.
Agreed.
So,
Medical school pimping part 3. Of the few people who have defended it, other than the medical student who has no idea what's going on, they're not describing pimping. I pimp my students all the time and found it to be an effective teaching tool. It's really all about not acting like a complete jerk. And my teaching reviews are extremely high from students. Then you're probably not pimping. You're just questioning. Pimping, literally by definition, like if you look it up in medical literature as an educational tool, is inherently stressful with the intention of putting somebody in their place. That's what pimping is. It's intended to reinforce a hierarchical structure within the medical, you know, educational community. Asking lots of questions and follow-up questions and everything is great. And if you do it respectfully, it's not pimping. But it sounds like you don't do it disrespectfully. It sounds like you don't intentionally humiliate your student. So you are not pimping them. So maybe we should stop using the term pimping, because we really need to get that culture out of medicine.
I feel like it, you know, I don't know if this system is ever going to change. I feel like it is such a big entity. And to your point, you know, it is this generations upon generations, like just inflicting their traumatic experiences onto each other. Mm-hmm. But I do feel like, at least in the past few years, there are more and more and more of us standing up to it and walking out of it. What do you think that stems from? Like, why are we? What's happening to us?
we're getting to the point where I think the second that physicians realize that they are disorganized labor, once we realize all the work we're doing, like the work kept going up and up and up. And and for anybody who is listening that isn't like involved in this, it's all the administrative burdens that are placed on us by the insurance companies to essentially receive reimbursement for the services that we're doing. Instead of asking you, if you come to me and you have my services, instead of me billing you directly, I submit to your insurance company. And it used to be that you go, hey, I did this thing for Emily. Can you please pay me back? And they used to be like, sure. And now it's like, hey, I did this thing for Emily. Can you please pay me back? And they're like, but did you do this thing? What about this thing? How about this thing? You didn't document that thing. And you know what? We will pay you, but you didn't meet all those other metrics. So you're not going to get that payment. Like, literally, they turned it into a game to get your reimbursement from the insurance company. So to play the game, you have to use all these codes and additional modifiers for this. It's a game, and that takes time.
Try to change the PCP on our insurance card, and by now it's almost 5 o'clock and you still.
So what I'm hearing is that, once again, insurance, by the nature that they make it so difficult to get your care covered as a patient, you have to have the right name on the insurance card and all this stuff. You got to make all these calls and fill all these paperwork. And if we don't do this, then it's probably not going to get covered, and you're going to get a massive bill that they should have covered, but it would have been covered if you had had the right name on the card. So what I'm hearing is that, once again, insurance has created a mutually unbeneficial relationship between a doctor and a patient. The patient who arrived and was ready to receive care, and the doctors and providers were ready to give care, she's not going to be able to get it today. And that can be frustrating. But it's also like, we just can't stay in the office forever, especially when we have to go home and do our notes. These are the types of things that make us not do our notes, by the way. And the providers, they would have stayed later if it wasn't like taking forever to get the insurance thing figured out. But now this patient is raging at the doctor. So now the doctor and the staff have a really bad interaction at the end of the day. They got a rage review, which is going to cause some issues. And they didn't get to see a patient and they didn't even get to be paid. So it's not like they're just sitting there getting paid and you're just SOL. The insurance company has made these relationships really difficult. And do you know who always takes the fall? The clinician, the doctor, the NP, the PA. We are the forward-facing people of this, and we always take the fall. And it's their fucking fault.
So guess what? Then your company starts hiring billing and coding experts that can go through your charts and do these queries and say, hey, you saw this person in the hospital. I'm sure you remember this. Her BMI looks to be whatever, and you could actually add severe protein calorie malnutrition to her diagnosis list, and that creates a larger complexity to the patient, which will maximize billing. And so then you, as a physician, you're just trying to do your work, and you have all these different people telling you that you need to do this, this, or this. Then the next step is that it's really the Medicare thing that started out as a good thing that turned into a bad thing without the proper regulations. There was a shift to try to do more things outside of the fee-for-service model. So instead of just getting, I'll get this amount of money for doing this thing, it's like, well, how about we do something that's value-based? How about we make this so that we incentivize you doing good care? But here's the thing. The only way to judge how do you judge if somebody's getting good care? It's through metrics. And so there are certain metrics that we use to determine what healthy is and what healthy isn't. And in some cases, getting a patient to the point where they meet the metrics actually might mean that they are not happy or healthy. A great example of that is a diabetic who can't afford insulin pens. So they're using the vials, but they're very unsafe with it because they're not very good at it. So they could so we're just trying to get their A1C down by pumping them full of insulin, when that's actually going to harm them because they're not doing it properly. Or we keep adding meds and meds and meds instead of having like conversations about diet to meet these metrics. That's one area. The other area is inflating how complicated the patient looks so that we can demonstrate how much money we saved when it typically costs $200,000 to care for a patient in this world. If you did it for $50,000, then that's $150,000 of shared savings. And guess what? We're gonna share that savings with you. So you would actually think that is a good model, right? Like, oh, if we can save money, it should be shared. But the problem is that shared savings money is now money that is being seen by companies as being left on the table by Medicare, and that's tax dollars. So guess what? Now you have a company hiring people to find that money left on the table, to add weird little codes that make them seem more complex, that actually, it technically applies, but like a great example is atrial fibrillation being known as a hypercoagulable state, like a blood clot. And you can if as long AFib doesn't give you that risk adjustment additions, but hypercoagulable state does. So who's gonna be able to pay for the people to comb through the charts to get that money on the table? Investors. And that's so now we have a world where you have the hospital administrators are trying to harvest this money from Medicare, from this shared savings, and you have investors that are like, we can help you do that, just give us some of that. And that's what private equity is. And so private equity and administrative efforts are both playing this game with Medicare to get money, and none of that is going to patient care. And like that that is one of the biggest reasons that despite a person who is extremely for health equity and access is very much against the expansion of Medicare and the concept of universal health care in the United States, because universal health care in the United States means universal insurance. And as we know, Emily, insurance does not mean health care. And that is, and we have to like separate that. So all of that's a mess. It's a mess.
Yeah, and that's hard to do because, I mean, obviously there are two huge influences over the industry: pharmaceutical companies and insurance companies. And I don't think people understand that. Insurance companies really do dictate your care. And how a doctor is able to practice. It's pretty wild. And there is a big lack of understanding. I don't know that we are even close to being set up to be able to provide universal health care. I don't know. To be honest, I don't even know that it's a great idea. Not with the way things are now.
We have to take corporate interests out of medicine before we do that, because you're spending the amount of Medicare spending. Now we can fact check this or whatever, but I'm pretty sure it's like 900. I don't even want to say it. It's like, I feel like it's like something crazy, like 900.
An astronomical amount.
And I want to say billion. I want to say billion. Wow. But but we'll have to fact check that. Yeah. It's something crazy. I looked it up because when I say 900 million, I don't think that doesn't come close to what I think it is, but maybe I'm wrong. But even if it was 900 million, like this, the amount of money that is being circulated in this system that isn't actually going to healthcare is the problem. So the expansion of a system that is really just rewarding corporate elite, which it really is, and these big corporations, and exploiting the labor of all of the healthcare workers. And they're the ones taking the shit from the patients, not just literally as a nurse, but figuratively. When everybody's pissed off, guess who they get mad at? To your point, the forward-facing person, the doctor. The doctor that they think is doing nothing for them and making this huge salary. And I can tell you, I have not taken a salary. It's now 2.5 years. And the only reason I've been able to do that is because I had a mother that passed away and I was her only child.
I think there will be a piece missing from me for the rest of my life. And although I may try and fill it with people or things, I know I will always fill that void.
That's the only reason I've been able to live. But I think the only way we're going to get out of this is for us to boycott the system. And that means for us to systematically support legislation that reduces our reliance on insurance. There's the way that healthcare providers leave the system is by stopping taking insurance or joining practices that do not take insurance. A lot of people frame that as concierge medicine, and I think that the insurance companies love to say concierge medicine because they love to imply that it is somehow for the elite and it is super expensive. But it's not. It's not. And then the way that patients can do that is stopping using insurance, starting to patronize places that don't take insurance and using alternative models of insurance like health shares instead of these major corporations. But I think the first step is education and legislative incremental change. But no, we're not going to get out of this system anytime soon.
If you are pre-med or in medical school or in residency and planning to do family medicine, and you've watched my videos and you've seen me complain about primary care, listen up. I basically, if you would have asked me 2 years ago, like, should I go into primary care? My answer would have been hell to the fucking no. Don't ever do that to yourself. Like, what are you doing? But I think that we are going to take this back. I think if you pay attention to the real business practices of what's going on, and when you negotiate your contracts and you do these things and get what you need out of these companies for the first few years of practice to build your patient panel, all these things, then afterwards, opening up a direct primary care practice, it can be very lucrative and fulfilling, and you can be a part of the change in getting out of the fucking healthcare system. I know a lot of people think that direct primary care is inaccessible, but I want you to think about it. Direct primary care, we don't take insurance, we just take cash. I intend to charge $2,000 a year to be my ride or die, and I will have a cap of patients, no more than 400 patients. That's $800,000 a year. What can I do with that money? I can hire the best of the fucking best people to help me. Anyway, the point is, if I could go back, I would have done anything to make sure that I got my student loans paid off. I would have worked for a 503c non-for-profit and done public student loan forgiveness. You're going to be miserable for those years. You're going to be miserable. But if you have an end goal of getting out of the system, I think it can work. And in the meantime, right now, there are a lot of us that actually want to make changes to the system. And I know that it seems, like I said, inaccessible, but I want you to think about $2,000. Right now, most people in the United States pay like what? $5,000 to $10,000 a year for insurance with an $8,000 deductible that they meet on December fucking 15th. And then they're scrambling to get their, toenail removed. It's crazy. And then they can never get into their primary care doctor anyway. And so then they end up going to urgent care, and because it's out of network, they're paying $300 anyway. Imagine $2,000 a year for somebody who's there for you all the time. I'm going to make a video about this on its own, but I just wanted to kind of come on here and give my update that I no longer regret doing family medicine. I just regret doing it the way that I did it, and I regret not paying the fuck attention to what was going on and trusting that everybody above me and around me had my best interest at heart and my patient's best interest at heart. They are taking advantage of you. They will try to take advantage of you. They are extracting capital from your labor. They are exploiting your labor. If you're a resident, your labor is being exploited. The amount of Medicare dollars alone that are brought into a hospital system from a residency program that manages Medicare, insane. Hundreds of thousands of dollars. You're not getting it. The attendings aren't getting it. Some fucking asshole in the C-suite is getting it.
I think I want to circle back to the question that you originally asked was, why do you think this is happening?
Yeah.
And I think that ultimately we are watching the system collapse beneath us. And I think those of us in healthcare are starting to be scared of what this is going to look like for us when we get older, because we see that why would anybody in this country ever want to be a doctor, a nurse, a cop, or a teacher?
Yeah.
Why would anybody want to be any of those things anymore? You know what I mean? Like, why would you
because they
ever
don't
want that?
know. They don't know what they're getting into, sadly.
Yes. So I think that's the big change, is starting to see the drop in what nobody wants to go into primary care. That's for sure. And now what they're doing is they're actually exploiting young nursing students. Their big corporations are investing in online NP schools and then putting them in situations to make a shit ton of money for the executives, doing what should be done by a physician. And in many cases, if you're a nurse practitioner that was like a nurse for an RN for like, it used to be that you had to be like a nurse for like at least 5 years, but most of them 10 years before they even went into NP school. And then on the other side, they had the respect for it. They understood it, you know.
Yes.
But now it's like, okay, you do your associates in nursing, and then you go to this school, and then you get put into a rural area, and you're seeing, 50 patients a day under collaboration of a physician, air quotes, and yeah, and then they're miserable. They are among the most exploited people. The APPs are among the most exploited in the healthcare system. So I think we're all seeing that, and that's like, let's get.
I know, and it's like I hate that it's happening, but I think it's a good thing that we are seeing it, because I do think it's what will lead to change.
Yes.
All right, everybody. Now the meeting has commenced, and our first item of business is to talk about residency spots. Oh, thank God. We need more residency spots. We need help. We need help. Family practice, didn't you get the memo? Like, we're trying to cap the number of residencies to keep our salaries high. What? Then why is everybody leaving? Why have we hired 10 NPs? Guys, don't do this to us. Pediatrics agrees with family medicine. Wait, Derm, does it work like that? Could I make even more money if we cap our residencies? Shut up, night shift house officer. It doesn't work like that. You're so fucking weak. Oh no, it works like that. We've been doing that for years. That's what you think. Didn't you know your practice was bought by Team Health? Who's Team Health? Nobody. You'll find out. We all found out. Bro, you good? Don't ask him any questions. What are you thinking? I knew this meeting would be a waste of fucking time. All right, everybody, calm down. We're just going to put this to a vote. Where's OB? Anybody see OB? I know they were supposed to be in clinic, but they're probably in the OR, right? Like, that's where they always are, right? Or are they in clinic? Are they in the OR? No, fuck it. We're not going to do a vote. We're going to keep the residency spots low because we all want to keep our salaries really fucking high, right?
So we talked about how, well, first of all, I want to say about insurance companies. I don't know that a lot of people realize insurance companies were initially designed to be used like car insurance. And
Yes.
that's not how they're being used anymore. These insurance companies have taken over. It's like these investors figured out that there's money in this industry and they figured out how to make it. And there are, to your point, so many of healthcare professionals and patients that are being exploited for them to do
Yes.
so.
Well, nobody uses their house insurance their homeowner's insurance to upgrade their kitchen.
Right?
Nobody uses their car insurance to get gasoline or to, like, that's not how it works. We use it for catastrophic things, but now it is our currency for
Yes.
healthcare, and it should not be.
Should not be. It should not be.
No.
So so we talked about the insurance companies. Now, what about pharmaceutical companies? Like, I don't know what a curriculum looks like in med school because I've never attended, but from what I understand, that there is a large percentage of it that is directly funded by Big Pharma, at least in the United States. So
I saw that you said that, and I don't know about that. For me personally, I never had any I actually find I think the big pharma influence is getting worse because of pharmacy benefit managers, not necessarily because of their influence on medical education, but I don't have any data about that. All I can tell you from my perspective is that for the first 2 years of medical school, you have you don't learn any brand names of medicine. Like, you don't know Xarelto, you know Rivaroxaban, like, you don't know anything like that. And you actually have kind of a shitty pharmaceutical education compared to pharmacologists, like pharmacists. Like, they have way more. We have 1 semester of pharmacology, and it's usually like an afterthought of like, oh, here's everything about the diagnosis. Treatment is something that you start learning, like actual how are we going to treat this is something that you start learning in your 3rd and 4th years, which is and then in residency. And that's the area that I wonder if has more influence by pharmaceutical. I'm trying to
could
picture it.
be. Do you think there is enough emphasis on nutrition and
This is a great
preventative and holistic modalities?
So here's the interesting thing about this. I think that the actual prevention, at least in family medicine residency, was completely drilled into us from an academic and a scholastic standpoint. But the practicalities of implementing that when you have 15 minutes with somebody, it's just impractical. But alternative and holistic and functional medicine, I would say, is very much looked down upon by the academic world. But that's one of those things that it's like, why don't we regulate vitamins the way we regulate pharmaceuticals, because if we did, then we would be a lot more confident prescribing these things, But I would say that if we're being indoctrinated about that, it is very subtle and is much more insidious, and I wouldn't doubt it, to be honest, Emily. Like, I have not had my full, because there's a lot of things, like when I think about my education and the way I want to treat, it's just that when people come into the office and they have 10 different problems, and one of them is diabetes, but their issue is their nerve pain and their back pain. And so what are you going to do? Like, how are you going to spend the time talking to them? Then you try to refer them to a nutritionist or a dietitian, but you have no control over the way they're talking about stuff. I have no idea what their influence is on stuff. This is also where the this is where I would say the pharmaceutical industry, it's not so much in the education. It's like, okay, now the pharmaceutical places will buy us lunch and they will give us samples. And that makes it much more easy for me to say, you know what, let's give you Janumet instead of prescribing, regular metformin. Let's give you this. And I have a sample of it. Here you go. And that's how it has influenced me. I have a mixed feeling about it because, I learned so much from the pharmaceutical reps about new medications, especially new things coming out for things like menopause and a lot of new meds for women. The whole GLP-1, like there's so many good things. The problem is the lack of regulation of where profit is and the margins, the markup margins. And a really good way to see that is Cost Plus Drugs by Mark Cuban. He is essentially eliminating the middleman. He is taking it directly from manufacturer, marking it up 15%, and it's very transparent, and then adding a cost for the pharmaceutical labor, the shipping, and this and that. And then you see, wait a minute, what? And the way patients are starting to realize that insurance and such is bad is through the drugs. Once they realize that they can get a medicine cheaper without processing it through insurance, that's the first area for me to go, aha, you're getting somewhere, aren't you?
That's a good point.
But the pharmacy benefit manager, I believe, is the linchpin of the pharmaceutical industry getting way out of control.
Evil con artist known as the Pharmacy Benefit Manager, Part 2. Let's go back to the 1800s when pharmacists, maybe otherwise known as chemists back in the day, or druggists even, they would operate and manage their own pharmacy and prepare their own medicines for customers. They would sell them on their own shelves. So back in the day, physiologists were learning to isolate various active ingredients and determine the effects on the body. The pharmacists would then prepare these medications for customers. Sometimes they would have a lab attached to the premises. They would compound their own mixtures using botanicals and minerals to make the drugs. At that time, a doctor could make a recommendation to a patient to seek something from the pharmacist, but the patient themselves could come to the pharmacy and get these medicines themselves, and the pharmacist could assist in making recommendations, similar with how over-the-counter medications works these days. These days, we obviously have a very different situation. We have giant pharmaceutical companies that do their own research and development. They then manufacture and distribute medications. So you would think that the way it works these days is that the pharmaceutical company makes the drugs, sells the drugs to a pharmacy at a wholesale type price, and the patient can go get the medication at a slightly marked up price from the pharmacy. This way, the pharmacy makes money, the pharmaceutical company makes money, and the patient doesn't have to pay too crazy amounts for the medications. But no, that's not how it works at all. The reality is that pharmaceutical companies do sell their drug at a wholesale price, but not to the pharmacies themselves, but to a wholesale distributor. There's only a few key distributors for medications in the United States. You may have heard of some of them, maybe McKesson or Cardinal Health. They serve as yet another middleman who buys the drugs at a wholesale price from the pharmaceutical company, then sells them to a pharmacy to turn a profit. The pharmacy then sells to the patient at a slightly higher marked up price, right? That's this simple, right? Wrong. This still isn't even the half of it. US, because everyone wants to make even more money, we've found a way to complicate this by introducing an additional third party into the mix, specifically insurance companies. Stay tuned for part 2, where I will introduce you to the con artist known as the pharmacy benefit managers that serve as yet another middleman to make a shit ton of money in this process while simultaneously making things way more expensive for the patient. And guess what? They do this in broad daylight because they can. It's all completely legal. Thanks for listening.
I don't know how much you want to go into that right now.
Well, I mean, we can go into as much as you want. I think, it's like I know we touched on this in the beginning, but you come out of this industry and like you go down these rabbit holes and you go through these emotions. And like for me, I'll admit when I first came out, it was like I hated the system. I wanted nothing to do with it. I never wanted to see another doctor for the rest of my life. And it wasn't, again, like doctors get a bad rap. And I always like to preface in my videos, doctors are not bad. They're not bad people. Are there some? Probably. And there's some bad nurses. There's bad in every industry.
There's bad everybody.
Correct. Yeah. But for the most part, they're good people trying to do a good thing, but their hands are absolutely tied.
I'm a family medicine physician, and this question is for doctors. Did this happen at anybody else's residency graduation? I don't know if you remember how awesome that day was when you finally got your diploma, you got your job. I've never felt more proud. But did anybody think it was weird that as soon as we got off the stage, they just put us in handcuffs? That was weird, right? It was so weird. I just had no idea that would happen.
And so, but I have, since learned that, there is a place for pharmaceuticals. There's a place for Western medicine, and there's a place for, holistic care. It would be great if we could
combine.
Yes. So I'm just going to say, if we could combine them, wouldn't that be amazing? But it's like for whatever reason, it probably stems back to Rockefeller in that era when things came out, the Flexner report. But I think there is this one or the other, and I
hate the one or the other.
Same.
I hate it. I also think that the majority of physicians would agree that the best, honestly, if everybody ate clean, reduced processed foods, exercised, got good sleep, good hydration, managed their stress level, then we would be working with a very healthy population of people. But there's also a side of the society that is pushing us to fast fixes. And that is the toxic productivity environment. It's like, okay, especially women who are expected to be. Are you a mother, Emily? I don't know.
Yes, I have 2 adult children. Yep.
So you don't look. You shouldn't have adult children.
Oh, thank you.
But I guess it makes with the time. I guess if like you've gone through nursing in a minute, good for you.
Well,
good
thank
for
you. Thank you.
But a woman that's expected to be a mom and a full-time worker and also create a healthy environment for everybody.
Yeah.
Manage her stress levels, sleep, exercise. Like what?
Forget it.
So one of the reasons why I think physicians get a little frustrated with this industry that it labels itself as functional medicine, which I believe we should try to find other ways of communicating it so that we don't find ourselves in opposition, is the room for exploitation of that. Room for exploitation of people's desires for something that could fix them with a pill. But they no longer trust the pharmaceutical industry, so they're being shown this Golgi berry vitamin. You know what I mean? Which doesn't have regulation. And I think that a really great example is I was on vacation. I have family members all over the walks of life, and I have a group of family that I went on vacation with, and the husband has current blood clots and he's taking capsaicin tablets. And I was like, ugh. Now, medically, if you walk through the actual science behind why that works, it makes sense. The problem I have as a physician with it is knowing that you could put eyeshadow in a capsule and call it capsaicin and nobody is gonna. So the best way to be healthy is to consume whole foods. But now we then get to inflation. We get to the cost of whole foods. Like, I gotta be honest, this is gonna sound like a Marxist thing, but when you look at all of it, it all just comes down to money.
Yes.
It comes down to pure greed and capitalism that is ruining our health all around, creating markets for exploitative things like this, which gives that a bad name, which then reinforces the negative opinions of physicians in this traditional world, which then makes them look like gaslighters when sometimes these things work. And here we are. Here we are. Like, that's
No, you're absolutely right. And like when you mentioned the goji berry, like, yeah, so perhaps the goji berry does work and there is research behind that. But what are you getting when you're buying that supplement? Because there
Yes.
are no regulations behind it. So no,
Yes.
I especially, well, I was going to say, especially when you're buying it from like online stores like Amazon, there's so many sellers on there. It's just impossible. You just don't know.
The
what you're-
regulations for that. The sellers,
Yep.
they, as a marketplace, like, this is a capitalistic environment where the marketplace is protected. We're
Yeah.
not the ones selling this. We're just a marketplace. We didn't make that. And those are the types of little things here and there that are insidious, that it creates these narratives. Sadly, I think that this is the big overarching thing, Emily, is that if anybody's expecting any political party to actually support improvement of healthcare in the current climate where there's so much dark money that you don't know who is funding any campaign, it doesn't matter. Both sides are using emotional rhetoric to, appeal to certain people depending on what their beliefs are. But at the end of the day, let's ask ourselves, when's the last time we had any meaningful reform with healthcare that actually made you feel like you were getting healthier? I don't remember any in my lifetime. And that's because, to your point, these big corporate pharmaceutical industries, insurance industries, to me, they're coming together in these super PACs and calling themselves holistic medicine free for all for America, donating to this campaign, when really it's Pfizer, United Healthcare.
Yeah. And who's protecting the consumer?
Nobody.
Exactly.
I'm a family medicine physician, and I am completely disheartened by how major corporations have taken healthcare from us. And when I say us, I say all of us, every single human. Medicine never belonged to the healthcare workers. Medicine belongs to the patients. The whole goal is patient care. Corporate interests that prioritize profits over patients, ruining healthcare. And I think we can all agree on that. And organizing is extremely important. It's really important that we come together to fight this. I can't do this alone. Nobody can. We have to work together. But what's really troubling from a group of very highly educated people, and I'm talking all healthcare workers right now, is that we have not learned the lessons of the United States of America. We have not learned that the two-party system does not work. It doesn't work because it doesn't accommodate for any nuance. It means that if you're in this bucket, it must mean you're this. If you're a Republican, it must mean you're a racist, and you must love Donald Trump, and you must hate the COVID vaccine. And if you're a liberal, it means you must want a litter box in a school, and you must want, predators to use the bathrooms. This is what we call virtue signaling. Virtue signaling ruins our political efforts. Have we not realized that by now? That while we're all over here arguing about the bathrooms, like, we're having these heated discussions about the bathrooms and who's using what bathroom. Meanwhile, the big people at the top are going, good. Keep them talking about that. Keep them talking about that. Because while they're doing that, we can still make every political decision in the interest of advancing our profits. And that is the United States of America right now. That is the US government. So in our movement, whereby we are trying to take back healthcare from corporate interests, I refuse to let this become a two-party system. I don't even want to say on both sides, because there aren't both sides. Just like in any political situation, there's always going to be the loud people that say very alienating, disheartening things that make you question the entire movement. So I'm going to tell you right now that I'm an independent. I share the values of all kinds of groups of people, and I don't want to be put in one box. I'm me. My page is exactly what it's always been. It's to show how awful primary care has become, how awful medicine has become at the hands of corporate interests. This includes insurance companies, pharmaceutical companies, and private equity that is infiltrating healthcare. So if you're with me on that, if you're a doctor and you're with me on that, if you're a nurse practitioner and you're with me on that, if you're a PA and you're with me on that, if you're a pharmacist and you're with me on that, if you're any other healthcare worker, if you're a patient and you are with me on that, stay with me. Join the movement to move fucking forward. Join the movement to be against corporate interests in medicine. Be the movement whereby we prioritize patients over profits.
And it's like, but here we are, we the people. I mean, there's so much. Why do we allow this? Like, why do we allow this?
We as people allow ourselves to get sidetracked emotionally.
Yes.
We get, everything becomes
divisive tactic.
Yes. I actually published a bunch of videos talking about how physicians need to shut the fuck up about COVID.
Yes.
Shut the fuck up. Get over it. We're in a new place. We are literally in a new place. We cannot make that our identity. It never was our identity. It's okay. Everybody, that doesn't mean you have to be anti-vax. That doesn't mean you have to be doesn't mean you, nobody wants to feel gaslit about
Correct.
their experience. And that's the biggest thing. But at the end of the day, we need to shut up. It's sort of like how we're arguing, and I don't know if you've seen, I'm very in support of trans rights, medically. But why are we talking about the bathrooms?
Right.
When it's we don't make semiconductors in the United States. That's because it's a lot easier for us as citizens to argue about these things that are emotional than to actually, it's much better for the politicians up top to distract us from what is going to support their bottom line, which is usually their side investments in the military industrial complex.
Yes. Follow the money.
Here we go. We're really go. Yeah.
Yeah. Good. Well, listen, this is such a huge topic.
It's huge.
It's huge.
And
There's
I
so
love
much
it.
to talk about. Same. So I'm just going to touch on the trans rights for a moment, because I do agree. And I think that, and even with the vaccines, everything, people should be able to make their own choice.
Yes.
From my perspective. Now, how do you feel when it comes to children and those treatments?
For gender affirming care?
Yeah.
So I actually published a really good video. I think you would be surprised to know that the World Professional Association for Trans Health recommends against surgical gender affirming care in minors. It recommends against it unless it is in the case of somebody who is going to die, lose their life. And I think that is also one of those areas where I believe most parents want the best for their kids.
Yeah.
And I think that the narrative that parents would ever want to have their child go through anything that would harm them, that's disrespectful to parents, in my opinion. But if you're a parent that their child is saying that they are Liam and not Layla, and they are dying inside, and you've gone through all these routes, which are very well laid out in the World Professional Association, all of the position statements of all these LGBTQ places, they all of their position statements have very specific and rigorous criteria of diagnosis of gender dysphoria, how the credentials of the person diagnosing it, the multidisciplinary team. It is, I think so. What it comes down to is that I do not personally feel like I have the credentials or understanding to suss that out. So I do not practice I don't practice hormonal or medical gender affirming care beyond giving a biological girl who identifies as a male an oral contraceptive to help him not have a period. You know what I mean? Like, but I think that we've overinflated how often this is happening. Who is like, I think it's not as big of an issue as people think. It's not an insidious concept, and the majority of healthcare professionals agree. We are in consensus that surgical means should not be done unless absolutely necessary. But here's a fun fact for you. 97% of gender affirming surgeries in minors are actually done in cis het boys, meaning they were born a boy, they identify as a boy, but they have breast tissue known as gynecomastia, and they get their breast tissue removed. And that is gender affirming to them.
They're looping that in.
Yeah. But that is because they've looped it. Yeah. That's a part of because that's one of the codes. Like that is considered because gender affirming care, that's another thing, is we do gender affirming care all the time as women and men, like cis. I do, I'm an Iranian girl. You think I want to wake up with a beard?
Right.
No. I did if I wanted to affirm my gender as a woman, and I got laser hair removal, so I don't do that. Fun fact, when a postmenopausal woman starts taking estrogen to address the changes in her body and her physiology after menopause, or when a man starts taking exogenous testosterone to help him get his libido back, his ability to gain muscle mass, when a woman who doesn't feel womanly gets breast implants, or when a man who feels womanly with breast tissue gets them taken away, all of those things are gender affirming care. Why should we not have gender affirming care for everybody? I just love Dr. Summer. She's my friend. I just can't get over, again, vagina equals woman is far oversimplified and gross, to be honest. Oh, that's so funny. It is gross, but Dr. Summer, in my experience, that is what most men think woman is. Woman is vagina. I am vagina. I am legend. Oh God, what are we doing? So I think that the numbers are skewed, and again, they're being used as emotional tactics to distract from the real things, because most people agree that we want safety, education, healthy food, affordable living. I think we need to start focusing on what we have in common instead of what divides us, and ask ourselves what are our end goals instead of what are our little nitpicky things that we're going to say about this. And once we can agree on what the end goal problems are, then maybe we can have discussion. However, that will never happen unless we have campaign finance reform, because our politicians are always going to want to pander to the people, the big organizations that are going to donate money to their campaigns. So even if they personally don't believe in a certain thing, they're certainly not going to piss that group off. You know what I mean?
Yeah.
And this is both sides.
Very
It's
frustrating.
Not one,
Yep, it sure is.
It's
one
not
bird.
one side.
One bird.
Yes. So I don't know. That was a long-winded answer.
Yeah, no, but that was good, and I respect that, and I think especially the numbers part there. I think that's an important piece to have gotten out there, that that those numbers are skewed.
Yes.
I hadn't thought of that.
Yes. And there's actually a Harvard study that was published in JAMA that included 40 million adults and 20 million children. And that's how this was. It was a cross-sectional. That's where it was. And yeah, we're there. Let me say one other thing, Emily. Yeah. Another problem with the trans health issue is that we've grossly oversimplified what biological sex is in the world. We X, Y, and XX. First of all, I had a patient who was XX, delivered children 11 years ago, and then one day had issues in her abdomen, and we did an ultrasound, a transvaginal ultrasound, and it looked to me like she might have had ovarian cancer. They did a biopsy, and it was testicular tissue.
Oh my gosh.
There's something called ovatestes that exists.
Oh
There's
my
a
gosh.
whole sexual middle ground called being intersex. You can have both, but outside you look like any other woman. On the inside, you feel like a woman. Your chromosomes are XX, but you somehow have ovatestes, and your hormones are normal, because biological sex has been grossly oversimplified. And it's, to give you a really great example of where the real genital mutilation is happening, is at birth, when a kid is born looking kind of funny down there to us. Yes. What is it? Is it a boy or a girl? Well, guess what? They get their gender assigned to them at birth, and they are doing surgeries. Now, we'll keep the circumcision conversation out of it, but the idea that somebody like a newborn baby has ambiguous genitalia for whatever reason, and that they allow the parents to decide, what is this going to be, then what do you think that might do later on in life?
Yeah, my gosh.
And I think we don't talk about that. Who's going to tell their kid that?
Oh,
I mean,
God.
who's going to tell their kid that? Who's going to talk about that? And we don't talk about those things because it's embarrassing, and because we don't talk about it, sex has been grossly oversimplified to X, Y, and
I wonder how often that happens. Like, what are the statistics on that too?
I have a statistic on that. Intersex, it's 2% of the population is on the spectrum of intersex, and many of you will never know, because it's not going to ever present itself in a way that makes you, like, a lot of it is internal, like having internal organs that are both and not having external organs, or I hate to, here's the other problem. This conversation becomes fetishized and pornographic at some point, to the point where it's difficult to even talk about it from an educational standpoint. I'm filming something right now about intersexuality, and I'm trying to find a way to talk about it that it doesn't get taken down. But, like, not all women with very large clitorises are on hormone therapy. Some of them are intersex. Not all men who have micro penises are just unfortunate.
Right.
They're intersex. They're intersex. It is a spectrum just like anything else. We don't talk about it. It's more common than identical twins. That's the statistic right there.
Wow.
But I wonder, that's because not everybody will have imaging and biopsies.
So it could even be more.
Could be more. I mean, I think it's really funny how we understand this for all kinds of other things about the way we present. Like, a woman isn't necessarily born with breasts. Like, there's many women who can have kids, breastfeed, that have completely flat chests. You know what I mean? And that's a feminine quality, but nobody says they're not a woman. You know what I mean?
Yeah.
Like, every other phenotypic expression of genes is pleomorphic and has numerous impacts, numerous influences that we don't understand. But yet, for some reason, we have really oversimplified biological sex. And I think part of that is just the general difficulty in discussing it without it being fetishized, sexualized, and we are puritanical at heart in the United States. So we just don't want to talk about that at all.
Yeah, you're right. You're absolutely right.
Yeah.
And sometimes you can't, because, to your point, how can you get taken down and censored? So it's difficult.
Yes. So this is what it's come to in the United States. When we're talking policy and then somebody actually presents the facts about something such as gender-affirming care, and I talk about an article that was published in JAMA by the Harvard School of Public Health, this is what we get. Harvard law professors can't even define what a woman is. I don't know how factual a study from them would be. Really?
You don't know how factual a study from Harvard would be. So who do you trust to get your information from? Where do you seek your facts? Do you think facts don't exist? I feel like this is just a big assault on truth in general. And I really would like to know who could publish an article that would be factual for you. What do you think? He said Alex Jones. If you can get censored for telling your own medical story about how if you can be told it's medical information because I chose to quit doing a certain therapy, that's not medical, it's a personal story. So we are, and not to mention the scrutiny that you get, the over politicization. When I talk about this, I'm painted as somebody who wants children to be undergoing sexual reassignment surgery. That is not that is not something that's not something I want, but that is also something that I do believe should be in a toolbox and shouldn't be legislated, because at some point there is a team of people, your parents, the child, the behaviors, the psychiatrist, the surgeon. You think surgeons are just going to do that out of nowhere and risk like catastrophic consequences? So we can't just say no. It's just like everything else. But it's really complicated. It's really and it's been used, unfortunately, as a means of scaring people. And it sucks.
It does suck. It does. I feel like that and abortion are the two biggest subjects that these politicians use to enrage people, upset people, and it's frustrating because, I mean, both, from what I understand, it's like less than a 2% chance that you're going to experience that, but yet I agree the availability should be there, but they present it as if it's happening in 50% of the population.
The thing that bothers me the most about that topic is the concept that any doctor would be pro-abortion, meaning I would like you to get an abortion, ma'am.
Can I please do that? Yeah.
Or that any doctor would have a woman, again, I find this to be disrespectful to women. What woman has a pregnancy in their 3rd trimester and goes, I don't think I want this anymore. I'm gonna just like get rid of this. And I'm sure there's a doctor that's completely fine with that. These situations where, first of all, 91%, that statistic may be more, that's the minimum. 91% of elective termination of pregnancy happens in the 1st trimester. And when it's the 3rd trimester, we're talking horrible, sad. I mean, it is. I had a patient who had a desired pregnancy, and when the heartbeat bill was active in Ohio, she found out that the baby had anomalies that would allow it to live to the 3rd trimester and possibly be born, but it would not possibly be born. But the more likely scenario that she would miscarry sometime in that 3rd trimester, or if the baby was born, it would die within hours. What kind of person wants to carry that pregnancy to term? What kind of woman is callously, that was so upsetting for her. She was afraid to even bring it up to me because she was afraid of what I was going to say about it. And it's like, these are could you imagine going through it? You're already losing a child. I mean, I can't even imagine it. I personally would not want, not to mention, we don't understand babies' pain and suffering. We don't understand that stuff. I mean, that's another medical thing that we did. Babies don't experience pain. You can just give them a little drop of sugar on their tongue. They don't have pain. Oh my God. So these are all the types of things that are very nuanced. Medical discussions are very nuanced. We already have a difficult time getting influenced by all of the other factors in medical education, let alone now politics influeing it and influencing those conversations. So let's bring back the nuance to it. Let's allow people to have conversations with their doctors, allow doctors and patients to make decisions with one another for their care that is right for them within reason, within reason. So
yeah, I agree with you. It just seems to be getting worse and worse. And I always kind of felt like it was like every 4 years, like you knew something was going to be changing in healthcare. You didn't know what it was going to be, but because there's always, their policies, and some of them are good, but some of them are very, very disruptive.
Yes.
And you were kind of always waiting for that to happen. What's going to change this time around? It's frustrating that amount of power and control is held by people who don't understand the system itself and are making decisions that are not patient-centered.
Absolutely. I mean, they don't even understand them. The politicians not only don't understand the medicine, they don't even understand what's happening from a economic standpoint in the healthcare system. I think it is the most difficult thing. Understanding the revenue cycle of medicine is an entire year's worth of curriculum to understand it. Being able to communicate it is impossible. And to have the layman person understand how that is influencing them is almost impossible. So it's a lot easier for us to say feel good things like healthcare for all.
With no how this is going to happen. How are you going to do that?
And what does healthcare even mean? What does that mean to you? Again, in the United States, healthcare means insurance. I agree that universal healthcare done right should be the goal, but the initial step is not doing universal healthcare, extrapolating from a terrible system to everybody. You're absolutely right. Anybody who currently has Medicare would not choose to give it back because they are currently held hostage in a system where there's no other option. But the problem is, this is like organized crime racketeering. If you don't know what racketeering is, you should watch The Sopranos. But essentially, it's putting people into situations that they have no other choice but to take. Is that really what we want to continue to invest our money in? Like, well, it'd be a real shame if your building's set on fire, so you better pay up. Okay, well, I don't want my building to be set on fire, so I guess I'll fucking pay up. I guess I'll pay up. That's exactly what our healthcare system is doing. And the problem is we're all so fucking brainwashed into thinking that this is the way to go that we think, well, you know what? The next step is to expand this to everybody. That is literally giving more money to the most corrupt individuals of the United States and probably the world, like actually. And I think that what you need to realize is that I'm on your side. I'm on your side. I want everybody to have health care. But I think what people don't realize is there's a lot of alternative models that are happening, and I want you to pay attention. And you need to start educating yourself as to what actually it means to have universal health care. Does it actually mean you're getting health care? Does it actually mean your health care outcomes are improving? Are you actually getting what you need? Do you think that people are actually getting what they need? They aren't. They aren't. There are some people that are. But for the amount of money that we are paying into this system, the $900 billion that we are putting into the system, we're getting fucking peanuts shit from it. So why would we continue to give more money to these people without first taking a step and saying, hold on a second, let's educate ourselves, let's back up, and let's see where's this money going and how can we incrementally make changes to make sure money is flowing in the right direction? How can we make sure that all these middlemen aren't extracting capital from the system in ways that are not actually serving anybody's health for that matter? It's only serving profit. Do you see what I mean? We're on the same side. And I had a really difficult time understanding this myself. I've been a physician for 8 years, and literally it took me 7 years to finally start realizing this stuff. We have to deprogram. We have to stop thinking that insurance equals healthcare. Insurance is not healthcare. It's just not. I know it's really hard, but there's a lot of alternative models that can be extremely beneficial. In fact, the people who have too high of income to afford to have Medicaid, but the health exchange is ridiculously priced and you don't get much for it, they can choose alternative models of care. There's alternative insurance models. There's alternative healthcare models like direct primary care and healthcare shares. I want to talk about all these things. It's just that this is going to take some time and some education. And I think the biggest problem we have in this country is our brainwashing. We've been brainwashed. I was brainwashed. What? Yeah, we were brainwashed. We need to wake up. I'm currently uninsured, by the way.
Same.
Because I recognize that it's a scam. We luckily also have little laws in Ohio that make it so that your medical debt cannot go on your credit report.
Nice.
As it shouldn't.
I agree.
Because whether or not you're a responsible purchaser has nothing to do with if you were in an accident and you got life flighted for $45,000 by a privately owned company that ran this life flight that owned a helicopter and was like, we're going to make $45,000 off of this. That doesn't mean you're not a responsible spender. Should medical debt be wiped off your credit report? In this commentary, I've had a little back and forth, but their final point is that all debt is debt and debt has to be repaid or else there will be no lending, and not paying debt is immoral. But I want to ask you this. If I come across a few people in the desert that have been out there for days with nothing, and I have tons of cold water bottles, and I say, hello out there, we have some water, come get some water. And they're like, oh my God, thank God, you saved us, we need water, oh my God. And then you give them the bottled water, and they're like, what do you want for this? And they're like, don't worry, we'll send you a bill. And they get the bill, and it was $5,000 of water. It was $5,000 for one water bottle. They had no choice in the matter. They didn't know what it was going to be. They would have died if they hadn't done it. But now they're either going to have to give up their last money that they had, or at least divert it away from other things that are more important to them and the ones they love, or they're going to let it default. They're going to let it go to collections. In cases like these, the lender is not the victim here. They're the victim of predatory lending, which is the fundamental basis of the U.S. housing market crash. I do not have insurance. I will not buy traditional insurance ever again. I will not take traditional insurance ever again. And I said this to my lawyer, who's trying to, with all his might, make me do things to make it so that I don't burn bridges forever. Yeah. I was like, Greg, I would rather be a sex worker than take insurance again. And
I love that.
I would feel more respected. I would feel more respected doing that.
Good for you. Yeah.
Yes.
Yeah. It's a rigmarole. It's expensive. It's what you have to go through to get something covered that you're paying for. I mean, it is just, it's such a game.
It's a game.
I've not had any problems. I've had to go to the doctor a couple times. Actually, I just went to one last week, and he set out a plan for me and said, here's your options. You can pay me weekly, monthly, per visit, and I'll give you a discount if you pay it all at once. The doctors will most likely work with you in that, and it's affordable. In fact, it's costing me less than it would have cost me for 2 months of insurance.
Delivering a baby in the healthcare system costs up to $100,000 depending on what you get. In Ohio, I've had several patients deliver a baby and use their out-of-pocket expenses, and it costs them less than $5,000 to deliver a baby. Now, some people don't have $5,000 to do that. Mm-hmm. But it's like, when we talk about how the insurance industry has inflated its own costs, that's something that people don't understand either. And I like to give the analogy of, if I own an MRI machine and you, Emily, need an MRI, for me to run this, buying the MRI machine was expensive, maintaining it, having a rad tech run it, having a radiology read it, having all of these things, in place. That costs, let's just say it's $1,000 each time I run an MRI. That's the cost for me. Mm-hmm. If you came to me and I was like, okay, it's $1,000, and you're like, okay, here's $1,000. Okay, great. That's directly paying. But the way we do it is we say, hey, insurance, it was $1,000. And they go, great. We'll pay 20% of that. And so I get $200. And guess who gets the bill for $800? You,
Yep.
the patient. So guess what I do next? I say, you know what? I want more than 2,000. I'm not going to, the patient's not paying their $800 bill. So I'm operating at a loss. So what am I going to do? I'm going to tell the
Raise your
insurance
price.
company it's $5,000
Yep.
so that I get my 1,000 and I don't give a shit about anybody else. At least I get my 1,000. But now what are you, the patient, responsible for if they're only paying 20%? $4,000. And that is how insurance inflates the cost of care. And they literally, I always call it, it's like racketeering, like the mob, like buying, well, it'd be a shame if that building burned down. You better pay up so that you can,
Yeah.
I mean, literally that's how insurance is it's like, well, what happens if you get that? What happens if you get
never
that life
know.
flight?
Yes.
It's like, bro, the reason the life flight costs $47,000 is because you did that.
Yep.
You did that.
That's a perfect explanation. I agree with you 100%. It is these hospitals, practices, doctors are not getting what they need to be paid out of the insurance companies, and so they have no choice but to raise those prices. And then yes, it's a trickle down effect.
Yes.
Take insurance out of it, man. What this whole industry would be something different if
I-
insurance was just taken out.
I've basically, my platform, I try to keep talking about all kinds of other things, but the amount of people that don't understand what direct primary care is and how unfathomable of a concept it is just shows you how brainwashed we are to have insurance be our currency in the healthcare system.
Yep.
Like, and of course that's going to set us all up for failure. If you're paying $10,000 a year for insurance, which is not uncommon for families, and then what, you have an out-of-pocket max of $8,000, like that, so you could feasibly pay $20,000 a year, but guess what? When you go to your doctor, you can't get in to see them, or they spend 15 minutes with you. Of course it feels like they're being cheated. Of course they hate you, the doctor, because they see themselves as, I pay $1,000 a month for insurance for my whole family, and this is what I'm getting, and it doesn't even cover my meds. It doesn't. The problem is, it is so complicated because we've allowed it to be deregulated in such a way that it's unfathomable. So I've been talking about direct primary care because I truly believe that the more people exit that system and start to get a little less afraid
Yes.
of what could possibly happen to them. The racketeering fear. What?
Yep.
If as soon as you stop fearing your tomato stand being burned down, you can live your life again.
Yes. Yes.
And imagine if you put your pre-tax income into something like an HSA, which now is maxed, is now capped. But imagine doing that and having it not go to administrative people, but having it be something that you can control. You know what I mean? That money, I mean, think about the amount of money you would say. How much did you pay for insurance when you were?
Well, so the last, I was at a private practice in my last role, and for myself, my husband, and my daughters, my son was out of the house at that point. He's already had his own place, so would have been I think it was like $437 a month.
Yeah, which is
what I paid, which, and that was 6 years ago. So,
and that's pretty
4 years
good.
ago. That's
pretty good. But did you get $400 a month worth of care?
No, and I also had a $8,000 deductible I had to meet. I had whatever 20% of my prescription costs. So like it was not. It's not.
You're
like
not even
everything
getting
correct.
You're paying into that system, and that's what I keep trying to nail down, is that as long as there's people who are just profiting off of your health, our labor, like, we're never gonna, like, you're not going to get good health care. The difference between our system and the other systems that function with universal health care, because there are countries that do function well and they don't have shitty health care, is scale. It's a much smaller area. They understand, like, it's not like it's
We're huge.
You were huge.
Yeah.
And we are being influenced in ways, these industries are being influenced in ways that are impossible. The campaign finance issues don't exist in other countries. In the UK, you can kick out the prime minister in the middle of a term.
Wow.
We should be able to do that.
Yeah, we should.
We should. I mean, at the same time, there's just so many aspects. I think if I had to drive home, the biggest thing that would change our country is campaign finance reform.
Yeah.
Because it would start to put knowledge back in. As long as we were given the information and understood it, it would be pretty eye-opening to see, instead of the PAC name, the super PAC name that's donating, knowing who is in that.
I agree with you.
I think that would change so many things about what we're doing.
Yes.
And so,
yeah, because I mean, it's money driven, and a lot of people don't want to admit to that or don't understand that, but it is. Like, these politicians are not, making decisions because they think this is truly what's best for you and your well-being. I'm sorry, I just don't think it's happening. I think that, and granted, there's some politicians that I believe are better at running things than others, but that doesn't mean that I think that they're doing it because it's my best interest. I think they have their own prerogatives, follow the money, but if we could understand who was paying them, we could understand what was fueling their decisions. And,
exactly.
It may be beneficial to us in some degree, but we are not the reason why those decisions are being made. I mean, maybe there's one in a million out there that really, truly cares about Americans, but it's hard when you get in those positions and you're making money and the money's flowing and, you're going to be influenced.
Or you have to look at the concept of, the money that they have in their mind that they want to do a good job, but they have to get elected. And it costs so much in our country. Whoever makes the most money wins the elect. The fundraising is who wins.
Yep.
And so how are you gonna, if it costs $1 billion to run a campaign, you're not getting that from your grassroots.
Nope.
I'm sorry, you're not getting it from my $10 donation that I do.
Yep.
Monthly. You know what I mean? You're not getting that. And so what these politicians do in their heads, and I find this to be something that we did in medicine, is we start to justify it. We go, okay, I'm going to get this money, and that's going to allow me, a good person who wants good things for America, to still be in this. But then now you're beholden, and you start to see, and unfortunately, that's just how it is. You know what I mean?
Yeah, it is.
So your intentions may be good, and this is where I have fallen. I don't think that doctors that stay in the system are bad. I think that
they're probably stuck.
They're stuck,
Yeah.
and they don't realize that they're enabling a system. That by doing that, they're enabling a system. But I also, Emily, I don't have a family dependent on me. So, I mean, imagine if I have to pay my monthly debt to my old practice. I have to pay my monthly debt to the U.S. government for my student loans, and I have to pay for my living. And these nails don't just come out like this, so it's like I have those things. But imagine if I had to pay for childcare, food for everybody, education, all these things. If you're a physician, you're not going to want to take major financial risk and go off on your own into this world that is, I would say, targets of the insurance industry. Okay, hear me out. Deciding you want to be a doctor when you're 18 and going into medical school in your 20s is like getting trapped in a multi-level marketing scheme where the buy-in is $500,000. You're promised opportunities to save the world. We're gonna do this together. It's literally an MLM cult. that you can never get out of. You'll never get out of it. Because even though they told you you'd get that pink Cadillac, if you sold all those lipsticks, nobody gets the pink Cadillac. They used to. But that's before healthcare became a for-profit machine that is not interested in health, but money. So I guess I'm stuck with all this product in my garage that I can't get off my hands. And by product in my garage, I mean my medical degree, $500,000 of student loans, and I don't have a garage because I don't own a home. And I'm 38 years old. The direct primary care movement is something that is absolutely not liked by the status quo of anything, because it puts the power back into the physician and the patient's hands.
Yeah.
And
takes the corporations out.
They don't get to profit off of your health and my labor anymore. So
you will not take insurance at all in your new practice? It will all be self-pay?
yes.
Do you think that there's room for some of these providers? Because I do agree. I think a lot of them are stuck too. That you come out of med school with such a high amount of debt in most cases. Like providers aren't making a profit until it typically takes years and years and years before they dig themselves out. So do you think there's room for them to open their own practices, or these entities that they start, they take insurance, but maybe do a separate self-pay route and just really encourage self-pay? Or you think it just needs to be all or nothing, like take the insurance completely out?
I think it's impossible at this point. I don't think, as a person who went through this, I don't think I would have the business acumen to start this out of residency, because not for nothing, I didn't have the education to run a business. And it's sort of like home ownership. I would never build a house from the ground up before having owned a home in the first place and figured out what I like or don't like about a house, because you don't really like little stupid things like having first floor laundry is something that people don't understand the benefit of it until it's, or second floor laundry. Like if you like the like little things like that you don't realize make your life so difficult until you've gone through the difficulty. And unfortunately, I think there's a few routes. MDVIP is a company that does both. They do bill your insurance, but they also have a membership fee that is much smaller. I think like $50 a month for most providers, which is pretty valuable. But they're getting that subsidized by, they still bill insurance. So you kind of, as a doctor, at this point, it's up to people like me and other people like-minded people to create a space and mentorship for outcoming primary care physicians. I would say that I'm going to take medical students to come shadow with me. It would be really awesome if we could standardize some ways for people to start their own direct primary care practice. The biggest problem is making sure that you're not accidentally breaking a ton of laws that exist that you don't even know exist. Like just weird, but a lot of the compliance things have to do with insurance.
Yeah.
So it's difficult, because I don't want doctors to just be rogue and not be held accountable for anything that they do. But yeah, so I do think that the middle ground, I tried to do the middle ground. I actually, when I was at my previous company, I was like, hey, can I please start charging a membership fee for people who want different levels of access? And I actually created a tiered system so that I could sort of say, hey, I understand you want to be seen tomorrow, but that's not possible unless you're in this, you know. They wouldn't let me do that, and I didn't understand why. And they were never explaining it. They were telling it. They were making me. They were gaslighting me, telling me, "Oh, it's because patients won't do that." I'm like, "What?" Or this?
How do you know?
No, it's because insurance companies, their contracts between the health system and the insurance companies are like, we're not going to reimburse you this much. If you're also getting membership fees, then we're going to reimburse you less. This is also the problematic, I mean, Emily, I could talk all day, but the problematic thing about both sides right now, talking about the tipping stuff, like tips, but not taxing tips is the first step to putting a huge class of people at risk of losing all of their wages, because as soon as a company gets an idea that, hey, your tips aren't taxed, so we don't have to pay you as much anymore. And so now we're all reliant on the goodness of everybody, and the changes of the economy. If you're in a downturn and all of a sudden you don't, like, so
now
I'm
you're making
really
less, and so your tips are less too, because everybody, it's
and the reality is that the people in that economic strata, they're not getting taxed in a way that, like, on those tips, in a way that is making a substantial difference, because they don't usually make as much. So it's really another one of those dumb campaign things that doesn't make sense in practice, and both sides are like leaning into it.
and it's a Band-Aid. It's just, and this is what happens, these Band-Aids, instead of fixing the real issues, we are putting Band-Aids on things, and then in turn it's creating 55 more problems.
Maybe let's make it affordable to live in the world.
Yes, yes.
Like, maybe make childcare affordable. Childcare is a major issue right now. I get a lot of criticism for not having children. What a weird thing, by the way.
Yeah. Like, how dare you?
I'm like, well, first of all, I don't have a partner. And like,
Right.
I've seen how hard it is. You think I'm going to do? No way, man. I'm not, I don't think I could do it. I could do it, but I wouldn't be happy. But the point is, there's all these things that we just really, it just all comes down to corporate greed.
Yes, it does.
Yeah.
It does. So, okay. I don't want to spend a lot of time on COVID, but I do want to mention one thing about it. My thought on this entire pandemic is that it has led to a lot of people who no longer have this blind trust in the system and in their providers. And I don't necessarily think that's a bad thing, because I think that they've learned to, take their health a little bit more seriously, and maybe are seeking different modalities for themselves. But it's also created a very negative, especially again, for the doctor. So what are your thoughts on that? Like, where we are, how it changed things, where we are now, and can it go back to the way it was, or are we past that? And is that a good thing?
Well, I think the politicization of it is what ultimately made it a problem. I think we have to remember that there's a couple different pieces to this, right? Like, at the very beginning of the pandemic, what we saw happening in New York was real. It was really happening. In Ohio, that was never going to happen. The New York healthcare system is very different than our healthcare system here. The people are different. Again, this comes down to the big. So a one size fits all mode for everybody is not necessarily what needed to happen. I actually got into major, so I also have my master's in public health in epidemiology. I don't know if you knew that.
I did not.
So when this happened, I was one of the few doctors, and I'm not anti-vax. I get the vaccine. I'm like that, but that did not think that the ways that we were going about it were going to create way longer term problems. We weren't considering the full health of a person.
Yes.
It was sort of like being afraid of a plane crash so much that you neglect automobile accidents. And so was a lockdown necessary for a few weeks to figure things out? I think so. To slow that for 2 weeks. Yeah. 2 weeks. Like, let's just stop this because we need to stop. We don't know what's going on.
Let's wrap our heads around it.
Let's wrap our heads around it. The amount of people that were what was very different about COVID from influenza is how easily spread it was. And the math of that, the messaging of the math is the part that was the problem. It's not that COVID was going to kill everybody. It's that 1% of everybody, if everybody got it at the same time because of how fast, that would be a catastrophic overwhelm to the system. So we needed to like stop that. But doing that longer, the messaging got, I mean, we were doing it, the messaging got all wrong. And then it turned into a place where if you said anything critical of the way that these things were being managed, then suddenly you're in this aisle of misfit healthcare providers.
Yes.
And to be fair, I was not happy to be gaslit by patients telling me that this wasn't happening, because it was happening. It's just the messaging was horrible. I still think the messaging is horrible. But once you then made it into I guess what's the word? A virtue signal? Once you made it into a virtue signal and you had to pick a side, because you did.
Yeah.
Then if somebody saw an inconsistency with anything, they're going to lose all trust in you.
Yep.
And it's just a shame. I would say that it is that politicization is one of the biggest health crises of our time, because the global vaccination rate of global in the United States, not global, but amongst everybody is going down for all diseases, and we're getting polio again.
I know,
and like, not everything is the same.
Right.
Not everything is the same. You know what I mean? And
I do.
It's just very frustrating. Me and my dad actually had major words at the beginning of the pandemic because he was very proud. I mean, I'm in a red state. We used to call it purple, but I would say it's red. It's Ohio. Our governor DeWine was excellent. He was listening to the experts and stuff. He was doing the best he could, but I felt like there needed to be more influence. It should never just be one industry discussing the implications. As a epidemiologist, we know that the spread of disease and everything, it's social. There's all these factors. So we have to consider what's happening when kids aren't going to school. What does that do to the parents that then have to stay home? What is it doing to the kids who don't get a good meal at home?
Right.
What's it doing to the kids and the people who get abused that now they don't have they're not going to the doctor, they're not going to school, and nobody's reporting these things anymore?
What's it doing to their mental health?
What's it doing to their mental health? So I was critical of I just said, we are not New York City. I did all my clinical rotations in New York City. We are not them for a million reasons. There are places that were, you know what I mean? But then you get to the other side where, because if you start talking like this, then it makes you sound like you're a person that doesn't respect the health of the immunocompromised. And it's like, no, we do. But there's other health conditions out there. There's other things that influence. And by the way, I'm just going to say, like, I am vaccinated. I get my boosters. I want to do that. I do not believe it is unhealthy for me. I believe it is safe and effective in doing what it's supposed to do, which is reduce the severity, not stop it completely. But that doesn't mean that we have to make it our goddamn identity. And all of a sudden say that everybody needs to do this, or you're a bad person, or this or that. And then
that's where they went wrong.
That's where they went wrong. And that was the politicians, because I mean, look at how it flip-flopped.
Yep.
The administration that was in place started Operation Warp Speed to make the vaccine,
Yep.
which was incredible, an
Yes.
incredible feat, one of the best things that happened. Operation
I
Warp
agree.
Speed, in my opinion, is one of the best public health feats of all time.
Yes.
But then now that same party is now on the other side of the issue, and because it's now just become a virtue signal for
Correct.
everybody. It's just now for everybody. And then this side, I mean, I have patients that are still masking everywhere, and I'm like, that's if you want to, that's fine.
Right.
But like, it's a little different now.
Right. Right. Well, and they've all the fear that was instilled is, and that was politicians.
Yes.
I personally did not get the vaccine. I wasn't in healthcare anymore. So for me, it made sense. But I don't scrutinize people who do. I think it should have been a choice.
Yeah. I mean, honestly,
Yeah.
the flu shot is a great example of something that wasn't politicized.
Yeah.
And every year there's people who got it
Yep.
and there's people who didn't get it.
Yep.
And when you didn't get it in healthcare, you had to wear a thing that said you didn't get it, and it was fine.
Yeah.
And everybody was fine.
Yeah.
Do I understand certain industries, certain areas wanting it to be a part of the public health measure to help the community? Yes. I just think that it is like every other issue in medicine, it's nuanced. Once we start saying everybody's the same and this is the one way, whether or not it's safe or effective, or whether or not, forget the science, it's going to cause distrust.
Yes.
If you force anybody to do anything, it's going to start feeling a little weird and pushy.
Yeah.
It's going to start feeling like that. And
people are going to question it. Why are you forcing me to do this? And then they start thinking that there's ulterior motives. And I think there were in many cases. I think,
for some people there were.
Yeah.
I can tell you, I didn't get any of those. The biggest narrative that I hated was that I was somehow profiting off of it, because I certainly did not. It's more like the people who profit are in the high levels. Again,
Correct.
the government contracts. If Pfizer's going to make this vaccine and the government is going to pay for everybody to have it, there you go.
Yeah. Yep.
And guess what? Pfizer's then going to donate to everybody's campaign. It's just,
Yep. See?
but not everything is, this again, it makes you, in healthcare, if you say anything like this, it's like, what does this mean about
You're anti-vax or you're pro-vax?
Not at all. I am pro-vaccine.
Yep.
But I am pro
Choice.
nuance in medicine. Yeah, choice. I am pro-choice. Here are some things that I think, for example, I am a provider that doesn't accept children in my office that don't get the MMR vaccine. Now, I'll tell you why. Because measles can kill a newborn baby. And we are having a huge rise in measles in Central Ohio, and that baby can't be protected, and I cannot trust that. And measles is so spreadable. If you don't get your pneumonia shot or your flu shot or your COVID shot, whatever, man.
It's on you.
Have a good,
Yeah.
whatever. If you don't get your meningitis shot, if you don't get your HPV shot, fine. The MMR shot, the MMRV for me is the thing as a public health person, because of what it does to the people around you. And I mean, but it's nuanced, right? But
Yeah, I agree.
I don't think you're a bad person if you don't do it, but it's just that I have to make my decisions as a business owner as well, and how I'm going to protect my patients. And I was very concerned about that rise. And I actually have a picture of a little baby that recently just had chicken pox, because she's only had her one she's 1 year old, and there's a huge chickenpox outbreak. It developed secondary impetigo. I mean, this poor little baby is miserable and is gonna have scars all over her. And I don't want that in my office. But
I don't blame you.
But like, you can, I'm sure there's an office for you then.
Sure. Yeah. And
You
like,
know?
I mean, I'm vaccinated for everything else. I've always gotten my flu shot every year, you know, so I'm not anti-vax or against vaccines
Exactly.
either. But for me, it was a personal decision. And, you know, again, that's what it should have been for everybody. A decision between them and their doctor. But once again, yes, you're right. We allowed politicians to enter the realm and play on everybody's emotions. And they did the most bizarre things, some of them,
Yes.
you know, trying to push people into this decision, and it just pushed a lot of people away from the system
Yes.
altogether. So
Yes.
good and bad came out of that. I think, you know, again, people are taking their
Mostly
health a little
bad.
bit more seriously, but yeah, mostly bad. Now you've got people who will not enter Western medicine space anymore because they have zero trust for it. And that to me is sad. I know there's a lot of people out there who believe it's one or the other, but I think that every case it should be treated
There isn't.
individually. Right. Like
Yes.
if Western medicine works for you, great. And if you can incorporate some holistic modalities, wonderful. There's a place for prescription medicine. There's, you know, so
I think that
yeah.
everybody should be practicing holistically. I have a problem with the functional medicine space owning the word holistic. I don't like that. I find that to be a little gaslighty to all the doctors that are trying to do right by their patients and helping them create these healthy lifestyles. But do you know how it translates in 15 minutes? It translates to your BMI is you're too fat.
Yeah.
Lose weight. Stop smoking. That's
That's
how
all
it
you have
translates.
time for. Yeah.
But what if you could be like, spend all the time that you need with a patient to really understand what they're going through? And that's what I'm so pumped about in direct primary care, is doing a real assessment of what we're doing. And there's going to be times when there's non-negotiables. You're going to have to pry my sugar-free Red Bull out of my cold, dead hands. You're going to have to pry it out of my cold, dead hands. But here's another fun trope of doctors. It's either quitting smoking altogether or not, or you might as well not quit smoking. Like, no, less cigarettes is better.
Yes.
What? Like, why are we doing that? And that's because it just becomes easier to oversimplify things. My biggest sadness for the people that we lost in Western medicine is the difficulty that they're going to face in the world that is full of charlatans and snake oil salesmen exploiting them. When there's plenty of people that are doing a great job, there are also plenty of people who are not doing a great job. And those people are going to make them feel heard. And just being heard alone makes people trust you. And so you might start paying a lot of your money that doesn't need to be paid for. That's what scares me. We should have the time in medicine, especially primary care, to have these complex conversations about lifestyle. It is literally the most important thing that affects your health, in addition to your genetics, which we're still learning about. So
It's wonderful to hear you say that, honestly. It's wonderful to hear you say that.
I'm glad.
Yeah, because you don't, and again, it comes down to time. It is not that these doctors are good or bad. It's the time. It's
the time. And then you just kind of turn into a person that says things that, like, here's a really great example of something that I had to learn recently. I had not been up to date about all the new evidence about hormone replacement therapy in women. Like, that was never something that I was intentionally like going, I'm not going to do this because I was just like, I was basically similar to gender affirming care, using hormones in children that I'm not comfortable with because I didn't have the time or energy to invest my understanding. And the idea of me causing a breast cancer in somebody was terrifying. To the point where the simple thing for me to do is to say, I don't do it. But that's not really who I am. That's not who I am at all. In fact, like, I believe that in informed consent, at some point, why not? Maybe it is going to cause endometrial cancer. Maybe you would rather that risk as a patient and accept that risk than live in misery from your postmenopausal symptoms. And that is also a sexist area of our society where men have these options and then women are just SOL.
Yep.
You know what I mean?
I do. I do.
And so, yeah, I think the time that's robbed from us as physicians is also robbed from us in the area to stay up to date. If you have me back ever, I can talk to you
I'd
about
love to.
the numerous medical board investigations I've had against me.
Oh my gosh, no way.
Numerous. And they're bad sounding. They're bad. And they were all dismissed because they were asinine. And
what prompted them? I know. You know, I mean, and I know we've been
I'll talk about one of them.
Okay.
So when my boyfriend was in the catastrophic motorcycle accident, and I told you he had no medical physician, there was no internal medicine doctor on his case. There wasn't even an ICU doctor on his case. It was just the trauma surgery team. And this was a person who was in septic shock on a ventilator, had intra-abdominal abscesses, blood clots. He had more than just traumatic injury. The complex medical needs of him were not able to be managed by the surgery team, yet they repeatedly refused to do a medicine consult. And I believe there's an ego-driven thing. We can handle this. Very common in medicine. And part of it is because we know we can handle it intellectually, but what we have to acknowledge is that we can't handle it from a bandwidth standpoint.
Yes.
And that's something that it takes, like, you know, and then the other thing is that we're indoctrinated to say we need to reduce the cost of care. We can't have another doctor on this system. We have to reduce the cost of care. So anyway, what happened was that he ended up going to a long-term acute care facility. And for people who don't know what that is, it's essentially a nursing home for people who essentially should still be in the hospital, but they're just stable bad. So they're just like, they're just bad, but like they're just going to stay that way. Nothing major is shifting in one direction or the other. They almost killed him there.
Oh my gosh.
And so when he got readmitted, he was going to go to the trauma surgery team again. And I was like, this can't happen. His primary care physician couldn't do anything about it. So I worked for a company that had hospitalists in the system that took care of our patients when they were hospitalized. So I said, I got permission from the transfer center, the inpatient support center for our company, the chief medical officer. I got permissions from like everybody. I said, can we put my name as his PCP so that he can just automatically be on our hospital service? And they were all like, absolutely. And I'm like, I'm not going to do it. Like, I just want to make sure he has eyes on him. And when he's done, we'll have him established with one of our physicians. Years later, 2 years later, I'm getting a subpoena for medical records from the medical board. And the allegation is multiple acts of sexual misconduct with a patient.
Oh, you're kidding me.
And the patient was my ex-boyfriend. And I was like, what? Now, a lot of people think he did something.
Okay.
He did nothing.
Oh.
You can never know.
Was my first thought.
Nope. Not at all. Wow. It was an independent. You can never know as a physician what happened. I have my theories. I can tell I don't feel comfortable sharing all of them publicly. I will share with you them after because I feel like we're entering legal territory of allegations. But basically, under the eyes of the medical board, if you do anything under the authority of your license, then that is considered your patient. And if you have had a romantic relationship with them without terminating the doctor-patient relationship, that is considered sexual misconduct with a patient. So naturally, I was like, well, he wasn't my patient. I never saw him in the office. I never billed for his services. Like, why is this a thing? I literally was like, why would this be a thing? This is crazy.
Yeah.
And do you know what their answer was? Well, why did you prescribe vilazodone for him? Vilazodone is a SSRI. And I prescribed him a supply when he was discharged from the hospital because the hospital did not appropriately give continuity of care. So I actually went into his medical chart through my company. I documented, this is not my patient. He needs to establish medical care. In that thing, I did a referral for psych. I did a prescription for his psych meds. None of them were controlled substances.
Thank God.
Yeah, I know. None of them were. I wouldn't do that. None of them. They were literally.
Well, just because I can imagine what that would have done. You know what I mean?
I would have probably gone to jail. I probably would. I would have this on my.
Oh my gosh.
But their contention was, well, you prescribed those things. You did that. And I'm like, what doctor has not prescribed their husband or wife something? And my lawyer was like, but they're not the ones being investigated. You are. But there's no law that says you can't prescribe those things, right? There's no law that says you can't prescribe that to your loved one. So the way that they were getting at me, I do believe I was targeted. That's all I'll say. I believe I was targeted. And the way that they did that was through sexual misconduct with a patient. And by the way, that investigation is what prompted me. This was after my mom had died. I lost my boyfriend. Love him deeply. He is not mentally well. We just can't have I'll love him forever but I lost my relationship. I lost my mom. I was in $250,000 of debt to my practice. My patients distrusted me, some of them, like from the global concept of what a physician was. And then now I'm going to have my livelihood stripped away and my reputation that I built as a physician. And it's going to look as multiple acts of sexual misconduct with a patient. That's when I started my TikTok. Dr. Leila is sad. That's when I started it. And it was just a means for me to
get your story out there. Get your feelings out.
Just like I was hopeless. I was hopeless.
That had to be very stressful.
Oh, I mean, I have a whole. I lost hair. I mean, it was the worst thing that ever happened to me. But at the same time, it leveled me up. It put me then under scrutiny. If that had not happened, I would never have gotten to the point where I am now, leaving the system, because it catapulted me into a space where I was being scrutinized by my company in ways that it was similar to the conversation we were just having about, it's like, methinks you doth protest too much. Like, why are you so worried about me saying this stuff? Why are you so worried about that? And it just never made sense to me. And I thought they were on my side, and they weren't on my side. And I am telling my story and getting all these people who have much more knowledge than me and have their experiences. And that's when I went, and that's
it all came together.
I beat that, and I beat subsequent ones. I get targeted by people on the internet. They make complaints about me. being an unprofessional doctor. We could have a whole thing talking about professionalism. No, but like this whole thing about being professional on TikTok when I'm not a professional TikToker. Herm agrees. I should have linked the lipstick in TikTok shop so that I could be a professional TikToker. I'll do it now. You know what they say, haters are just more people paying attention. That's another area where physicians are trapped into silence, the constant, and not because you can even just having any alternative mentality about anything can have somebody investigate you against what are you doing things against the standard of care, like, and then you lose your license. That's your whole
Yes,
life.
this is an example, and I have said it before on my social medias that this is what can happen. This right here is why nurses, doctors, licensed individuals do not speak out because they are afraid. Because here you go. Here's a great example. Even when after my first couple of videos, I had people calling somehow they found out where I lived, where I worked, and were calling I had left there. And it was kind of like, ha, like, screw you. That's why I waited to talk, you jerks, because I knew you were going to do that. But I mean, obviously nowhere near the degree of what you dealt with. My God, I cannot even imagine the level of stress you had to have been under. I am so sorry that happened.
And
to
I
you.
didn't have my mommy. I didn't have my
you poor
mommy.
thing.
And my dad's an Iranian man where God love him. He's a nice person, but he literally, I mean, an allegation like that, I mean, that's a humiliating thing. Saying that you were accused of something like that, we all know that accusations make people automatically think something's wrong.
Of course.
Like that certainly you did something. And so I just suffered in silence about that. And then, of course, was being told to tone down my physical appearance for the medical board.
God.
Like stuff like that. Like, oh, don't have your nails be because what? Because if I am a woman that I'm a predator, what?
Right?
Like,
my God.
Like, we're talking, it was one of the most eye-opening experiences for me. When you asked me initially what was the thing, I mean, there's just so many things that led to this, that medical board investigation, I would say, ultimately.
Tip the iceberg.
It sent things into motion that will never be undone, which actually makes me want to tell you, I haven't shared this with my following because I want to trademark my name.
Yeah.
But my practice name is Rebell and Thrive. Rebell and Thrive.
I love it.
Rebell and Thrive, direct primary care. Now, of course, my lawyer who was like, oh, Rebel, you're not only are you going to sound untrustworthy, but you might be confused to being a Confederate sympathizer. I was like, what?
No.
I was like, I don't think so. I was like, no. But I said, all due respect, I said respectfully, people don't trust the status quo.
Correct.
So
that is an excellent name, especially in this time. You know, maybe 10 years ago I'd agree with him, but no way. That is impeccable.
I think it's exactly, and you know, a lot of people who've scrutinized it in my personal life who know me are like, well, why do you feel the need to announce rebellion in your name? Like, you're obviously rebelling. You're obviously And I said, because it's about the bigger movement, and we have to frame this way.
Because it's not obvious to the public.
It's not obvious.
Not enough of them.
So if I wanted to take a safer business move, I would call it In Good Hands Primary Care. You know what I mean? Yeah. If I wanted to do a safe thing, I would do that. But that does not intrigue anybody. It doesn't.
I love it.
It doesn't. Thank you.
Yes.
I love it too.
I absolutely love it. And you are trademarking it. You better. I have a good trademark attorney if you need one that trademarked my What the Healthcare.
Well, if they charge less than $600 an hour, I might.
Oh yeah, it cost me like $2,000 the whole thing.
Okay, yeah. Because honestly, my lawyer is my team of lawyers. I have a team because I have my I
You
do
have to?
because you have to, especially the medical board stuff. All of my healthcare lawyers are previous prosecutors for the medical board.
Oh,
I
wow.
And so I basically chose them to as such, but they're very
Smart.
expensive.
Smart.
They're very expensive. So on trademark issues, I feel like I don't need to do that. We don't need their.
Yeah,
we don't need.
I'll send you the guy's info. It's all he does now, is trademarks, and he did a great job with mine. It was easy, and in fact, I think the reason it cost me so much was because I say so much, really, that's nothing, but because I extended it a few times. But in the grand scheme, yeah, I think it was like, maybe it was a little less than 2,000. It would have been for the whole thing, but I'll
Yeah.
send you his info.
Yeah,
And
and
he
I
can
also
do an
like
intro.
really these are also things that this is another point. You're a very educated, experienced woman in the world. I am a very educated, experienced woman in the world. And we're told that we couldn't possibly understand how to navigate this kind of world on our own because you don't know anything about this. Well, I'm sure there's a way I'm not going to do it because I don't want to mess it up, but I'm sure I could file a trademark.
I'm sure you could.
Do you know what I mean?
Yes, I do.
Like, but oh man, if I had the money and the time, I would go to law school.
You'd be
so
great.
that I could do. Well,
Yeah.
thank you.
Yes.
I'd be a scary person probably
be.
to a lot of people.
To the
but,
corporations and
man, maybe
yeah.
we'll get there. Maybe
You might.
We'll get there. Maybe, but yeah, I feel so affirmed that you said that because the criticism I've been getting in my personal life about this name because of the discomfort people have with that idea.
No, I think
I'm
it's,
like
I think
you
it's
just I'm like you just
wonderful
don't
and
get it.
impeccable timing, and you're right. They just don't get it.
They don't get it, and that's okay.
That's
That is
okay.
that's not my demographic who I want. And
There
not
you
for
go.
nothing, the whole point of direct primary care is I'm not trying to scale this to the whole world. I
Yeah.
want a small patient panel that
Yeah.
understands the mission,
Yep.
that wants to be a part of this, that wants to take my hand. Trust me, let's get out of this. Let's rebel together and let's
Yes.
thrive together. And that's like
I would
that's
love
what
to.
I want.
I would love to see you too. And you touched on this a little bit ago that you could, form some sort of group or create some sort of online course, something that you can help new providers coming out, or even providers that are ready to leave the system, and kind of help them get to that next step and how to create this. Because a lot of people probably don't do it because they just don't know where to begin.
There's
know?
the other issue, which is actually another thing to another point you made. There is the Direct Primary Care Alliance. There are groups that do this, but do you know what? Doctors are boring.
Yeah, most.
There's a lot of neurodivergence in medicine that is a superpower for them to get through the educational rigor that gets them to be successful. But it is one that makes both it difficult to engage with them in some matters without feeling kind of off-put, which if you understand that they're neurodivergent, you can have that. But a lot of people are in such a vulnerable position that they just think that somebody's yelling at that. Like,
Yeah.
it's just, so there's that. But then also, I really would like to get more involved with some of these groups to jazz it up a little bit. Like, because I don't think that, and that's another thing is like, I don't know. I don't have as very many. I mean, compared to you, like, I don't know I feel like I should have more followers than I do, but I'm also at the same time very proud of the followers that I have. But it's just, so I don't know what
I
to
think
say
you should
about
too.
that.
I think it's hard. The growth really. I was just talking to somebody about this the other day. Like, the growth that happened during COVID for people on social media was like this rapid. Our accounts grew like so quickly, and then now it's kind of leveled out, and so we're seeing more of kind of like the norm in how it is to grow on social media. You can do it, but it's much harder. It was so much easier during COVID. I think you have so much to offer on your account, so much good information.
Thank you.
Yeah, the stuff you put out there. And
Likewise.
well, thank you. And plus the stuff that you're putting out about you. I struggle like putting my personal I'm trying like to get better at it. Like I've done some like comedy stuff, but I would like to get like more of like me out there, you know, kind of like how
Yes.
you talk about your makeup and do some of your tutorials, like stuff like that. So I think that's excellent. You have such a good do you do other platforms too? Like you on Instagram or any of the
So
other?
I have them. I have to like get my I have the accounts. They're all under Dr. Leila is Sad under Instagram and YouTube.
Okay.
I haven't uploaded anything to YouTube. I don't know how to cross do that like in an easy way. And Instagram, I the algorithms are just not as democratized on those as they are on TikTok. Like for some reason the algorithm is more democratized. Like if whereas my feed is curated for me on Instagram before I even log in.
Yeah.
Do you know what I mean?
I do.
It doesn't adapt. So like the growth potential, but I do want to I need to cross do that.
Yes.
If you have any information about that.
I do actually somebody, and I'll send you an email when I'll send you that attorney and write this down so I don't forget. And I'll send you this app that I forget the name of it. Somebody was telling me about it today that you basically put one video on, it creates clips for you and it pushes it out to all your socials. So it's a really
Love
good way
that.
to market.
Yeah.
So I won't take up too much more of your time. Will you do telemed in your new practice?
That's actually the way that I'm starting.
Okay.
My whole way that I'm starting is telehealth and home visits.
Oh, I love that.
Now, my brick and mortar, that's only because I have a brick and mortar space that I'm building myself. Like, I'm a part of a new medical office building, and it's an investment opportunity for me to do this. And I was very excited to design my office in a way that instead of having 45 exam rooms, I have 3 exam rooms that are huge, we're not going to have your normal weird chair that looks like a medieval torture device. Clunk, 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 clunk. Like, what? The majority of people are going to be sitting comfortably on a nice couch with a beverage fridge. Because guess what? You don't actually have to fast for labs. Like, it's okay.
Love that.
There's some ways that you do, but some things you don't. Like,
Yeah.
they're just like things that make it much more easy. So I'm excited. That's being built though. So until it's built, I'm doing telehealth and home visits as needed, as determined by me. You know, like I'm not trying to be a home healthcare aide,
Yeah.
and and I'm not trying to be your family friend that drops by.
Right.
But I think I have incredible patients that have chosen to go with me. I don't need that many. I have about 70 that are invested in wanting to come with me. I charge $2,000 a year for. I'm going to have other tiers of access to me, but that will essentially get you anything most people could ask for, to be honest with you. The only
very
thing it doesn't,
affordable.
it's very affordable. And what, $2,000 a year? That's for 70 people is $140K.
Yeah.
You know what I mean?
Uh-huh.
That I want to remind you that I just left a job that I had a panel of 2,000 patients, and I was not taking a salary.
Oh my God.
Like, so a lot of people are like telling me, oh, what if this fails? And I'm like, if I make $60,000 a year, it will not be a failure.
Yeah.
Like
no way.
I was a failure in that model.
Yep.
And we have to start. It's ego. It comes down to ego. It is so hard to realize you might have been wrong about something.
Yes. So
sucks.
hard. What was the exit like for you when you I know you ended your contract early and stuff, but like how did they treat you? Like how was that whole process?
It wasn't kind.
Oh.
I mean, it wasn't. I had there was an adversarial relationship between me and the administrators that I was working with. But I really did not feel supported by them. However, one of them stepped down and a interim person was there who was extremely helpful because his wife actually is the head of the physician wellness, and she completely gets everything that I'm doing. Like, they're a lot more understanding, and understandably, we're not yet up into, so that was a lot better. They're the ones that helped me leave sooner than the 90 days, than this let me leave after 30 days. But yeah, I think I've successfully burned a lot of bridges. Unfortunately, not with any doctor. Every doctor that I worked with, all of my partners support me. It was the administrators. No patient. All of my patients are sad, but they were watching me die inside. So I would say the administrative. I didn't even get an exit interview.
Aw.
So I'm sure they were just like,
what is the deal? Like, I mean, I was an administrator myself, but I was the only admin in my department who had clinical experience, which was so surprising to me. But again, it was very eye-opening, right? Because it's like, okay,
Yes.
now I understand why the system's failing, because these, no one's
Yes.
thinking about the patient. I was like the only one, like, hey, before we make this decision, like, hey, can we think about how it's going to affect the patient and
Yes.
the doctors and nurses? Like, how dare you?
Yes.
But what is wrong with them? Like, how? I don't get it.
it turns into, they are now very tuned into the metrics. Everybody's got the person that everybody's got the person that they report to that is asking them, are they meeting certain things? And until you're ready to take on a substantial amount of criticism and upstream force, it's really hard. I mean, think about, you left. You were unable to manipulate the system in a good way. You were unable to affect change that was positive. You left. And so that's why, but I will say that I believe it was I believe my attitudes did not, they were kind of in direct opposition. The things I was talking about were in direct opposition to what was happening at this company. And they didn't like that. So, yeah.
Well, I'm super excited for you. When is your building itself? Like, when do you expect to be in there?
Oh, God. Well, it was supposed to be May of 2025, but then they are changing the lot that we're going to be in. So unfortunately, they had to resubmit all the permits, and now it's going to be in October. So I might have to have an interim. We're just going to see what happens. I'm going to be seeing telehealth patients by the end of the year. It's just some legal things that I need to get settled. I just want to make sure I'm doing everything right, not leaving myself, especially because of the public persona. I don't want to leave myself vulnerable to having that taken away from me in any way. As soon as I can do that, that would be great. And hopefully that brick and mortar comes sooner than a year from now, but it may not. And I might just have to sublet somewhere before.
Yeah. And you can sustain telehealth, I'm sure, for,
the amount of access that people have, if they can see you, most things don't need an in-person physical exam all the time. Like, it really doesn't. And there's all kinds of, like, I could literally put an order for somebody to get their labs drawn. It's going to be okay. And the home visit is available if I need it. I'm excited about that.
I'm excited for you, and I'm excited for your patients. Are you taking new patients?
I am. I mean, I am. I haven't technically, because the contracts aren't there, I haven't actually had anybody sign anything yet. So technically, yes, I'm taking new patients.
How do they find you?
Well, right now, because I don't have my new website, my old website was In Good Hands Primary Care, because I was forced to come up with a name when I left. They were like, we'll tell your patients where you're going if you know where you're going.
Yeah.
And I was like, and
check that box.
Yep. And so I had to I was like, okay, so right now you can fill out a form for information and follow up on ingoodhandsprimarycare.com. You have to type it into your into your browser because I haven't paid for search engine optimization.
Mm-hmm.
So it's www.ingoodhandsprimarycare.com, and at the bottom there's a form that allows you to say like how you found me, what do you want more information? Are you trying to work for me? What do you want to do here?
Okay.
So that's how you can find me that way. But for now, I'm mostly keeping my business open to my former patients because I really had amazing relationships with them. I was really lucky.
Oh, well, they're very lucky too.
No,
So
Coming up on this episode.
it's on Spotify and YouTube. I actually got my first episode taken down. I'm so upset from YouTube for medical misinformation. So I've got to kind of go through that episode and take out. It was a wonderful conversation with a woman. She goes by Speaker Lynette on TikTok and other socials, but she had stage 4 metastatic cancer, I think started in her breasts. And she actually at one point stopped her chemo and she did natural modalities, but it worked for her.
And
she went from 12 centimeter tumor to nothing.
And that doesn't,
so,
the frustrating thing is the misunderstanding of what medical misinformation is, because that's her story, right?
Correct.
And the body
Correct.
doesn't read the textbook always. I always say, like, that's a big deprogramming thing that we have to